Good morning. My name is Nina Martinez. I am the board chair with Latino Civic Alliance, a statewide civic engagement organization, and we host and organize the annual Latino Legislative Day, and a day when Latinos and organizations from across the state come together to advocate for the communities we live in. I will be the moderator today. The last few years, due to COVID pandemic, we have hosted the Advocacy Day virtually, but this year we have transitioned to a hybrid model, hosting Latino Legislative Day virtually, but also sending a leader delegation in person to Olympia for the legislative session since it started last month. We expect over 500 participants that registered for the event and watching live on Facebook, our website, and YouTube. I want to thank our virtual consultants, Ann Larson and Jennifer Hansen, and the supporting team at Event Support. Special thanks and recognition to our sponsors, professional interpreters, Milena Cardon and Fanny Cordero, with Council 28, Washington Federation of State Employees, CMAR Community Health Centers, Group Health Foundation, Northwest Carpenters, Lembacher Law, and our panelists that volunteered their time today to share their expertise and community partners like the Washington Commission on Hispanic Affairs, Moses Lake Community Health Centers, UW, Latino Center for Health, CMAR Community Health Centers, and grassroots organizations that work alongside LCA to serve the Latino communities. Today, we have scheduled over 85 legislative appointments, either in person or virtually. Next year, we anticipate returning to Olympia with a full in-person participation. I ask that each of you today visit our website, www.latinocivicalliance.org, to view our full agenda today and download the full list of legislative bills that we have been supporting or opposing, and we update that daily. We have presentations on healthcare and serving the Latin indigenous communities in Skagit County, and State Agency Director with Washington State of Social and Health Services. We will be talking about climate justice and impact of wildfires in agricultural community, the impact of indigent workers. Also, we have today Dr. Ball with Seattle Children's Hospital will present on opiate and fentanyl crisis, and Dr. Zayas with the University of Texas will present on the trauma children experience separated from their parents on the US border. Traditionally, we have a special program that starts at 12 p.m. and we will have performances by the Mount Vernon School District mariachi students and guest speakers like keynote speaker Senator Javier Valdez, members of Latino Legislative Caucus members, Governor Inslee, Chief Justice Steve Gonzalez, and finally, we are proud to honor amazing leaders to receive the 2023 Latino Civic Awards for their grassroots advocacy and fighting for justice in their communities. We will be recognizing Councilwoman Iris Garias, Mount Vernon Councilwoman, and community organization Padres Tomando Acción in Quincy, Washington. Last, for the first time, there's a new Latino caucus with over 11 members, and Representative Lillian Ortiz self serves as the chair. It is an important milestone because now we have a larger base of legislators to advocate for us in Olympia. I want to thank all our leaders that have joined me and LCA to continue and advocate for stronger legislation that will improve the lives of our Latino community members. Thank you. We will now begin our program. I am proud to introduce Dr. Leo Morales. He is Assistant Dean for Healthcare Equity and Quality in the School of Medicine with the University of Washington and co-director of the Latino Center for Health at the University of Washington. Welcome, Dr. Morales.
Thank you, Nina. I'm going to pull up my slides here. And I just want to start by saying thank you, Nina, for inviting me to be here. And thank you to the Latino Civic Alliance for the invitation. It's really quite an honor to be here as the son of an immigrant parents and someone who was born, raised, and educated here in Washington State. Today, I'm going to be talking a bit about the COVID-19 pandemic and its impact on Latinx communities in our state. My name is Leo Morales. As I mentioned, I'm a physician. I co-direct the Latino Center for Health along with Gino Eisenberg from the School of Social Work. I also have the role of an assistant dean and an appointment as professor of medicine at the University of Washington. I have no conflicts of interest to disclose. And a word about our center. Our center is a state-funded interdisciplinary research center that focuses on really improving the well-being and health of Latino communities in the state of Washington. So here's a brief update on where we are with the pandemic. I think we're all aware that cases have leveled out, although we still have a fairly high level of transmission occurring. over 100 cases per 100,000 is the last rate that's available from the State Department of Health. Of course, we're probably underestimating this rate because testing is much more difficult to capture now that we have at-home testing. But what we are very happy with is the fact that we have fewer hospitalizations, so people are getting less sick. And that's primarily due to increased immunity, both because of prior infection and because of vaccinations. In terms of variants, we've been mostly dealing with Omicron variants for quite a long time now, and it appears to be, there still are new variants of concern, but Omicron variants seem to be the ones that are predominating. So this doesn't tell the whole story. And this is really what I want to share with you today, is to say, the disparities in the pandemic have not been equally borne. The impact has not been equally borne by different communities in our state. And here we have 3 charts that show you the age-adjusted case rates, the hospitalization rates, and the death rates. And in all cases, you can see that Latinos in particular have been disproportionately impacted. So case rates are 48% higher among Latinos compared to non-Hispanic whites. Hospitalizations rates have been 87% higher also compared to non-Hispanic whites. And mortality has been 115% higher compared to non-Hispanic whites on an age-adjusted basis. And what this speaks to is really the higher burden of this pandemic that has been borne by Latinx communities in our state. This is important to keep in mind as we think going forward, because the impacts of this pandemic are still being felt and will continue to be felt for years to come. In terms of vaccination status, we've done a good job of catching up in terms of vaccinating Latinos, at least in the primary series. So you can see in the first 2 sets of bars, the comparison between Latinos and non-Hispanic whites in terms of initiating their primary series, completing the primary series, whether that was 1 or 2 shots, depending on the vaccine. Receiving any booster, you begin to see a tailing off, and then receiving a bivalent booster, which is the most recently released booster, you see now that Latinos are lagging behind once again. So I wanted to spend a minute talking about long COVID. So the earlier data about hospitalization rate and mortality speaks to the higher severity of illness that Latinos have borne, not only infection, but also severity of illness, leading to hospitalization and ultimately, sadly, in terms of death. What this does is suggest that there is a higher rate of long COVID in the community because long COVID is related to COVID infection severity, along with other risk factors, which I'll mention in a moment. The pie chart, really, what it's showing you here is data from the US Census Pulse Survey recently done. The last wave release was in January 2023. And approximately 22% of those asked to identify as Latino in our state said that they had COVID symptoms that lasted 3 months or longer. This is consistent with long COVID. 1% of those mentioned that they had been impacted highly by these symptoms. Another 10% said they had not had severe impact or lower impact, and 11% did not respond to the question about the severity of their symptoms. What this means, if we look over here at the right-hand side, given our population of Latinos in the state of a little over 1 million, is that approximately 225,000 470 may have long COVID symptoms. That's the 22% of the million. And that approximately 12,000 of those are probably suffering from high impact, another 100,000 from low impact, and 112,000 we just don't know. So related risk factors, as I mentioned, are COVID infection severity. So having more severe illness, like that leading to hospitalization, older age, type 2 diabetes, female sex, obesity, asthma, and poor mental health. And I'll share with you some of the prevalence of these risk factors in the population. Obesity is a problem among Latinos in our country and in our state. And what these charts show is the obesity rate on an age-adjusted basis among those who are 20 years of older on the left-hand side and those aged 2 to 19. And you can see with the light green bars being representing Latinos, approximately 47% of those aged over 20 and 26% of those 2 to 19 years of age currently have a problem with being obese. This predisposes to poor outcomes with COVID and to the onset of long COVID. On an age-adjusted basis, diabetes is also higher among Latinos. This is data for the United States. And what it shows is that Latinos have approximately 20%, a 20% prevalence rate. This is among those 20 and older of having diabetes. About 6% of those cases are undiagnosed. This data was drawn from a examination survey, so didn't rely on medical records. Was directly, the information was directly obtained from the population. We know that the pandemic has had its own problems in terms of causing mental health problems. And here's data from the Pulse survey, again, early January. And what you can see here, this is data for Latinos in the state of Washington. And you can see that there's a fairly high prevalence of symptoms with, for example, responding to the question around depression, having little or no interest or pleasure doing things, or feeling down or depressed on the left-hand side. Oops, sorry. You can see here that, between 20 and 30% are saying several days of these symptoms, somewhat lower some of the days, and nearly every day between 7 and 12%. Similarly for anxiety. So depression and anxiety are common symptoms that people are feeling. So the social determinants of health really are related to our general health status and are important to address because they are related to health. And increasingly, I think our public health and healthcare systems are responding. But here we have some data, again, from the Pulse survey on food security, economic security, and health insurance status for Latinx and white individuals. And I just want to share with you here that you can see food insecurity is higher among Latinx, with more responding that they have either sometimes not enough to eat or not enough to eat of the food they want. In terms of meeting household expenses, Latinx individuals are more likely to say it's somewhat difficult or very difficult to meet those expenses. And in terms of health insurance status, 14% of Latinos responding to the survey identified as not being insured, compared to 3%. So quite a big difference there. And health insurance, of course, is a key component of gaining access. So even among those who are insured, having a usual source of care is hugely important. And so even among those who are insured, being able to be identified with a clinic and have access to a primary care provider is something that Latinos do not have in the same proportion as other groups. This is national data and showing that usual source of care, not having a usual source of care, is higher among Latinos than other groups. And I believe this is also true for Latinos in our state. So having concordant care in terms of language and ethnicity leads to better outcomes of care. And what we know is that in our state of Washington, about 13% of the population identifies as Hispanic or Latino, but among those practicing physicians in our state, only 3% are. So this disparity is not only the case in terms of physicians, but is also true for other healthcare professions like nurses, dentists, physical therapists, occupational therapists, and radiology techs, going on down the line. So Latinos find it harder to find that concordant care in terms of language and culture. Language, approximately of those asked what language they speak at home, this is for Latinos in the state of Washington, only about 40% say they speak only English at home. So Spanish is spoken in approximately 60% of Latino households. And among those, approximately 25% identify as speaking English less than very well. So language access, either through bilingual, bicultural staff or through the use of interpreters, is very important, and high quality interpretation is key to making sure there's language access. So in summary, these are some of the challenges that we've seen through the COVID pandemic, and I think are worthy of consideration now. So Latino communities throughout the state of Washington have been disproportionately impacted by the pandemic. That's evident in the data. Latino communities are again lagging in terms of COVID-19 vaccination rates, especially with the newest bivalent vaccine. And so ongoing and renewed efforts to vaccinate at the community level are needed. Latinx communities are an elevated risk for long COVID-19 and COVID-19 complications. So these chronic illnesses that we've been talking about as predisposing to long COVID are also occurring in higher prevalence after having had COVID. So there's some association between having COVID and developing problems related to the heart, related to diabetes, related to stroke. And so it's a double effect. Both rural and urban Latinx communities lack adequate access to care, including access to linguistically and culturally concordant care, which we know is related to better outcomes of care. And that needs to be addressed through workforce reform. And finally, we need more research to understand the long-term impacts of the COVID-19 pandemic, not only on Latinx individuals, but also their families and communities. What has happened as a result of the pandemic in terms of the businesses, the jobs, and the children who have not been able to attend school on a regular basis, in addition to those individuals who are directly impacted by the complications and the sequela of COVID-19. So with that, I thank you for your time, and I'm happy to entertain any questions or move on.
Thank you, Morales. This information is extremely important, actually very concerning. I think, as you know, that many organizations like LCA and many that are joining us today, our community partners, participated when the pandemic broke to help with getting, encouraging Latinos to get vaccinations, COVID testing. And more recently, when a lot of the, when Governor Inslee dropped, the mandatory mask, and there were a lot of changes in the county, what we are hearing and seeing is that talking to Latinos around the state, they kind of have this belief, not everyone, that COVID's gone. It's no longer nothing to worry about. And so what I'm concerned about is that funding has really dropped to support community organizations to go out and do this community work. I would assume you're concerned about that as well.
Absolutely. And I think the other thing that we've learned through doing this community engaged work is that it is an important way to reach those who are least well connected with the healthcare system. COVID-19 is a concern, vaccines are important, but there's also the backdrop of all the chronic conditions that go untreated and unrecognized. So I think there's a huge need to improve access to care.
All right. Well, thank you, Morales. Thank you, Dr. Morales, for this. It was extremely helpful. Thank you for participating. Thank you. All right. Our next presenters are legislators from the Latino Caucus. We have Representative Julio Cortez and Representative Emily Alvarado. Welcome, Representative Cortez.
Es representante estatal del Distrito 38. Lamento no poder estar con ustedes en vivo esta mañana, pero los veré un poco más tarde. Hi everyone, I'm Julio Cortez, State Representative in the 38th Legislative District. I'm sorry I'm not able to join you live this morning, but I look forward to joining you a little bit later today. A little about me, I was born in Mexico City and my family and I immigrated to the US when I was about 5 years old. I grew up in Wabato, Washington, which is a very small immigrant farm working community near Yakima. My parents were farm workers the majority of my life, and thanks to their support, I was able to go to college, which is one of their big dreams. I graduated in 2009 from Western Washington University with a public relations and journalism degree, and began a decades-long career in the nonprofit sector working with at-risk and homeless youth and families. It was truly an eye-opening experience for me. The last 5 years, I've been working at the City of Everett, managing their communications and marketing programs, along with being the small and medium business liaison. These lived and professional experiences have motivated me to run for office and ensure our voices are heard here in the legislature. I'm honored to hold this position and hope that I can elevate the voices of Latinos from across the state. And one of those ways I look forward to doing that is through the formation of the new Legislative Latino Caucus, or the LLC, how we like to call it. I want to thank Representative Ortiz Self, who unfortunately was not able to be here with us today, for her leadership and willingness to be our very first Legislative Latino Caucus chair. I also want to thank Representative Ramos for his leadership and willingness to be our first vice chair. And of course, my colleagues who will be part of the inaugural Legislative Latino Caucus: Representative Stonier, Representative Mena, Representative Alvarado, Representative Reeves, Representative Simmons, Senator Valdez, Senator Randall, and Senator Saldana. It's an honor to work alongside these great leaders to support our community. Now, the Legislative Latino Caucus has a mission to ensure that the experiences, the needs, and the solutions of the Latino community throughout Washington state are represented, prioritized, and made real in our legislative process and policies. We envision a Washington where Latino individuals, families, and communities no longer face discrimination and know that they have the access, opportunity, and resources they need to have true equity and thrive. But we'll need you, right? We have to do this together. All of you need to be involved to ensure that we are hearing from our Latino communities from across the state. We need to do this together. Although there are many bills this session that the LLC is tracking and supporting, we have identified 6 priority bills which we hope to support. I'll go over them very briefly. In the House, we have House Bill 1228 from Representative Ortiz Self, which is building a multilingual, multiliterate Washington through dual and tribal language education. We also have House Bill 1048 from Representative Mena, which also has a Senate Bill Companion 5407 from Senator Saldana, and it would enhance the Washington Voting Rights Act. We also have House Bill 1333 from Representative Ramos, which would establish the Domestic Violent Extremism Commission, and House Bill 1406 from myself concerning youth seeking housing assistance. Now, we also have 2 priority Senate bills: Senate Bill 4247 from Senator Valdez concerning people who have been targeted and affected by hate crimes and bias incidences. We also have Senate Bill 5225 from Senator Wilson, which would increase access to the Working Connections childcare program. Now, these bills have been identified as priority bills for the Latino Caucus, but like I said, we have many more bills and budget asks that we are supporting. So stay tuned for the information to come out here pretty soon. And again, thank you all so much for being part of today. It's an exciting time of the legislature, and on behalf of the new Legislative Latino Caucus, thank you for what you all do for our community. Sigan adelante, échenle ganas, juntos se puede.
Wonderful, wonderful. Now introducing our next speaker is Representative Emily Alvarado. Is she with us?
Good morning, I'm here. Hello, everyone.
Good morning.
It's wonderful to be here today. Thank you so much for organizing this Advocacy Day. I'm Emily Alvarado, a new representative in the 34th Legislative District, which includes downtown Seattle, West Seattle, Georgetown, South Park, North Highline, including White Center, Burien, and Vashon Island, and really excited to be here. I think we have, you heard Rep. Cortez talk about the power that we have this legislative session with the creation of the Latino Caucus and so many legislators who are committed to coming together and really making progress for our communities and for the entire state. A little bit about my background. I come to this work having spent much of my life fighting for housing justice to make sure that working people, homeless people, people who are left out by the housing market can have a chance to have a safe, affordable home. And I believe that, having that home is a foundation, and I want to continue to make sure in the legislature that people have access to housing. Other things that I'm working on, and just reflecting what I've heard from advocates and from Latino community members, a real interest in making sure that we have a foundation for success for all people, which is built upon having public benefits that are available to help people when they're unemployed, to help people have access to healthcare, to help people have access to cash assistance and to services. One of the bills that I'm really proud to be working on right now is House Bill 1260. And that similarly looks at how do we make sure that our public benefit programs that help folks with disabilities and who have a work limiting disability are able to not only access benefits, but not have to pay back the state the value of those benefits, but instead be able to find real sustainability. I say that because we know our public benefit people are critical, our public benefit programs are critical, but they don't work unless they're really accessible to all communities, unless they have low barriers, unless they're designed to reach vulnerable communities. So that's a bill that I'm really proud of. We also know that we have significant workforce challenges across the state, and that's impacting healthcare, and it's impacting childcare, and it's impacting education. And I know that there are many legislators, probably some that you've already heard from today, who are committed to helping to stabilize and to grow our workforce, especially in critical services. Now, for me, I want to be clear that I think a lot of our workforce challenges can be solved by making sure that people have living wages. We have to increase our expectation of wages so that we can retain workers. I'm proud to be working on one small piece of our workforce on House Bill 1694, which helps address shortages in the home care workforce, a really critical workforce of folks who are caring for the elderly, caring for people with disabilities. We know this workforce is predominantly women of color and immigrant women who are in the home care workforce. And this bill will help to lower barriers so that more family members can have access to the home care workforce, reducing some of the burdens on examinations and testing and fees so that we can support workers and support people living in our communities. Those are a few things I'm excited to be able to work on, and I'm excited to be able to work on some of the other bills and policies and priorities that you heard Rep. Cortez mention. I think we have so much opportunity to work together, to show solidarity, to really reflect on and shine a light on the priorities of the Latino community and come together and make real progress together. As Rep. Cortez said, though, we can't do that unless we hear from you. So these moments of advocacy, these moments of reflection and organizing and movement building are so critical for us as legislators to be able to show what our communities need and to have the power and the confidence to make change. So thank you for being here today. You can reach me anytime, and happy to talk to folks, and thank you so much.
Thank you, Representative Alvarado. I just want to say that very inspiring to have our first Latino caucus. Very inspiring. Looking forward to working with all the members. Our next presenter is Sandra Rodarte. She is with Limbacher Law. She will be presenting today the challenges Latino workers face when injured and new training needs. Welcome, Sandra.
Thank you, Nina. Good morning to everybody, and it's a pleasure to be here today. I just wanted to touch base really quick on two things. When injured workers are injured on the job in the course of employment, it does not matter your immigration status. If you're injured in the state of Washington and in the course of employment, you are entitled to workers' comp benefits. And we are here to help navigate those benefits for you. Many times, the injured workers do suffer and are unable to work or return back to work due to their injuries. And most of the time, most of the injured workers do not know how to navigate this, especially in the Latino community. So I have been working for the last 15 years here at Lamb Barker Law to help navigate the system and help injured workers, especially in the Latino community, obtain those benefits for them. So we are here, we are in Bellevue and we are in Federal Way. And if you have questions regarding your claim, we are here to help you. We are seeing a lot of many of the injured workers are being set up for independent medical exams. And there is currently a bill that is gonna help with that for injured workers in order for them to be able to record those exams, because most of the complaints that we do obtain from injured workers is that they are only taking about 15 minutes and most of the claims are closed based on these exams. So there is a bill that will allow for injured workers to now record these examinations and to make sure that interpretation is done correctly, and also what happens during these exams, as many injured workers do not have that option at this time. So we welcome everybody to go and, and speak to their senators at this time, because it's passed the House. And so it's moving to the Senate floor to get that bill moved through and passed through as legislation this year. Also, I did want to speak about the issues with injured workers, that when they are not able to return to work, they are retraining that is being offered. So that's a benefit that they do have. And I do want to point out that it's very important that at that time they seek for legal representation. It doesn't matter if it's our firm, but just to go obtain that help. But I do welcome for people to call us if they do have questions about their workers' comp claim and how we can assist them. Our number is 425-455-3186. And we are, like I said, in Bellevue and in Federal Way, and we can assist you. We have staff that speak Spanish, and we can provide that assistance for you.
Thank you, Sandra. I have a few questions for you.
Mhm.
When you speak about injured workers, what are you, yourself and other firms seen around the state, a common problem? If someone does get injured in the agriculture, let's focus on the agriculture, the farm worker, and falls down injured, what is a turnaround for that individual to be able to get the medical care they need and also get back to work and maybe in a new field? What are the challenges?
The challenges that we see is that unfortunately a lot of the providers in the Yakima area or in the Lower Valley area do not want to handle workers' comp claims. So it's very limited to what providers they can see. So we help them obtain doctors here in this area that are more familiar with the system. I know it's a long drive, but we just want to make sure that they obtain the adequate treatment for their injuries that they do have. So we help them find a provider that will adequately treat them, and then that will, make the determination whether they're able to return to work. And if they're not able to return to work, then we help them secure some type of retraining that is adequate for them, that they will succeed in and not fail at when they do have to return to school. If they're not able to return to any type of work, then they should be entitled to a pension. And that's something that we would also determine if that's something that they would be entitled to.
Okay. The second piece of the question is, what kind of areas are they being trained in? Technology? What kind of employment? What does that look like in a view for someone that's been injured and is healed, and now what do they have? What can they look forward to?
Yes, and again, unfortunately for the agriculture workers in the Lower Valley area, a lot of the retraining programs are just for like receptionists or clerical. And I know a lot of the people in the farm worker community, that's something that they do not want to be retrained for or don't have the aptitude to be retrained for. So that's something that we want to work with the Department of Labor and Industries to make sure that there is programs out there that are that our injured farm workers are able to be retrained for that. That's something that they would like to be retrained for, and not just, this is all we have to offer and that's it, so we want to help those that are not able to return to that type of work, find work that they want to do and are capable of doing within their restrictions.
Or new training for something that they're passionate about. I think that Latino Civic Alliance has heard this for years about injured workers, not just in agriculture, but construction and other verticals, and how hard it is for them to get state benefits. And when they apply through LNI, the challenges too. I know there have been some changes in the state agency that have been good ones, but I know that in general, for Latinos, for them to understand the process is also another problem of how do they access? Does the employer notify the injured worker about their rights? We know that that's not a consistent situation all over for employers to really educate their employees as they should. So a lot of more work is needed for this. Well, I want to thank you, Sandra, for joining us today.
Thank you. And yes, and if there's any questions, please feel free to call at 425-455-3186.
Thank you, Sandra. Thank you. So now our next presenter is Mary Jo Ibarra. She is the Moses Outreach Behavioral Health Coordinator, Moses Lake Community Center, and she also works in Quincy, my understanding. I know she's done a lot of incredible work, and she's based out of Quincy, so she works with their agency, Community Health Center there. She will be talking today on workforce and climate justice, the health effects of wildfire smoke in Eastern Washington. Welcome, Mary Jo.
Good morning, everyone. Thank you so much. I'm not sure if Anne received my slides on time, but if not, I will go ahead and pull them up if I can. I have our IT guru here to help me in case that happens. But I first wanted to say buenos dias a todos. On this auspicious occasion, I want to also thank the Latino Civic Alliance for hosting this event, and also wanted to thank Nina in particular. She's a jackrabbit here from Quincy, born here in Quincy, so really proud to see her up on this stage. So really, really proud of her and the accomplishments she has done all of these years. So I'm going to, I think since I don't see any slides, I think I'm going to go ahead and see if I can share these. Am I doing this correctly? Okay, can you guys see these slides?
Not yet. I can't.
Okay. Rachel, do you want to help?
We'll figure this out. Okay, I think we're seeing, okay, excellent. We're seeing it now, Mary Jo.
There you go. All right. Okay, so I'm going to go ahead and back up here a little bit. I wanted to talk a little bit today about workforce. And the particular workforce I wanted to discuss today was farm workers and climate justice. And yesterday I wanted to talk to you guys about a conversation I had with my mom this last weekend. I called her up because it was her birthday. And we began talking about, she's been in Washington State working in agriculture since the 1950s. And we talked about some of the challenges that continue to happen, even, here we are almost 60 years later, seeing some of these issues. So, it was really important for her. She said, I really want to tell you guys how important the work is that you guys are doing when you guys are supporting this workforce. She said it's because of them that we have individuals that are probably on this call today. So I wanted to remind that, including my brother, Alex. So I wanted to first start off today and address a little bit, maybe a little history first about our coalition work. Our coalition work, we call it the Farm Worker Call, and it began just as COVID hit Eastern Washington. And the Farm Worker Call, or this coalition, began and was founded by promotoras de salud, outreach programs, and community health centers, community health workers here in Washington State. We basically identified that we needed to support one another during COVID And we felt it was important to share information with each other and across the state. One of the things that I knew that was going to happen was that we were going to become inundated with outreach work. So at that point, I asked Farm Worker Justice and Northwest Regional Primary Care Association to come in and coordinate those calls. And until to this day, we continue to have a great relationship with them, and they continue to hold those calls one time monthly. The call began first with Washington State individuals, and then quickly expanded to our Oregon brothers and sisters, and then also to the state of California. And now we have regular folks coming in from Idaho. Occasionally we have other partners coming in from Wisconsin, Texas, the East Coast, Arizona, New Mexico. So it's been a really great coalition working still to this day regarding COVID issues. The goal of the coalition and the calls that we make are basically to protect farm workers during COVID. And again, we're still in the pandemic, like Nina was talking about. And one of the things that we do really well is share strategies with each other across all of the Western states. And we also share information by region. So we hold phone calls where people are sharing information with one another. And we also share maybe hot topics that are coming up and best practices. One of the things that happened during the phone calls was that immediately the people who had boots on the ground began to raise some of the needs that we weren't addressing. And those were regarding wildfire smoke issues and heat issues. And you can just imagine if I had COVID and I'm a farm worker and I'm working in the middle of extreme wildfire smoke, and there's smoke particulates in the air, it's extremely hot, and I have to wear a mask. You can just imagine the kind of issues that many of the workers were facing and that we were hearing about. So in 2021, one of the things that I asked from the coalition is that if we could begin to look at, along with COVID, to begin to look at maybe creating a plan to work on wildfire and smoke, because at that point we had deaths in the farm worker community that just, we could not ignore it anymore. So what we decided to do was model the plan very much like how the governors from the West Coast gathered together. They said, we're going to work on COVID together as states. And what we said is, we want the same kind of model to be used to address wildfire smoke and heat. So that was kind of our goal at that point. And we had fantastic members from PECUN in Oregon, Farm Worker Justice, people from Northwest Justice Project, and our clinic in Moses Lake and Quincy Community Health Center. And there was other groups as well who began to advocate to develop a strategy to implement what we call the Western Smoke and Heat Protection Pact. So this is kind of this was the slide that we primarily used when we were educating people about what the Western Pact was. And so we shared this with many people across the country. And again, the goals for the Western Pact was basically to create build strong, consistent standards across Western states to protect farm workers from hazards of heat and wildfire smoke. At that time, what we decided to do was three things. One, write letters to each of the governors in the state of California, Oregon, and Washington. We also met with some state officials, as well as our state here in Washington. And we also had some media coverage regarding the work that we were doing. Why did we want to adopt the standards for heat and wildfire smoke across all states? The first reason was because climate change always has disproportionately impacted farm workers. We know that we're the ones that work outside. We're the ones that are working even in the midst of wildfires. We're the ones who continue to work when there's heat waves. And importantly, one of the things that we have very rarely talked about was that we are the ones who continue to work in extreme cold weather. I recall talking to one of our providers a couple of years ago, and he said, Mary Jo, you guys really need to start doing some work on extreme cold, because what we're finding is a lot of workers are getting frostbitten on their either their fingers or their toes. And so this is a topic we very rarely hear about, but I wanted to present as part of the work that we're doing as far as the PACT is concerned. Also, we know that agriculture is primarily done, as I said, during outside and during peak seasons when it's the most hot and when we typically see most of the smoke across all of the Western states. We also wanted to talk about how farm workers are really, unfortunately, while they've been named and deemed essential workers, they continue to be undervalued, and they deserve better treatment with their health, as Dr. Morales talked about, some of the barriers that we face, and also some of the safety protections in the workplace. And while there are safety protection standards in place, one of the things we know is that there's, and I'll talk about this later, is that some of those rules and education aren't happening at the same level across all of our states. So the other issue that we want to discuss was health risks that are increased by when we have both heat and smoke exposure, and also when we have COVID. So what we find is that agricultural workers, because they're working harder, they're inhaling faster, they're working faster, and so it just compounds how quickly they become exhausted because of heat and smoke, but also because of the physical nature of their work. We also know that, you get hot, and if it's hot outside, it just compounds that. So we begin to see issues around heat rashes, heat stroke, and unfortunately death. And honestly, you guys, we shouldn't be seeing people die of death. There's no reason for that. We also see that there's extreme heat stress and dehydration. And unfortunately, what we're starting to see now is that we're seeing kidney failures, and there's some studies that we'll reference at the end about that information. I think it's just really important for us to be aware of how impacts our population, our Latino population in particular. Let's see, the other things that we wanted to talk about was that, wildfire smoke has high particulate matter, and, of course, those are associated with huge health problems, and things we don't even think about, such as heart issues. It causes aggravated asthma. I mean, we know that. It just compounds it more. And we also have decreased lung function. So again, if you have COVID or any other respiratory issues on top of this, it just creates chaos with our health. And of course, we've seen it again and again, increased respiratory symptoms across the board, especially in particular with our farm workers. The other thing is that one of the things we really wanted to do was we wanted the rules to be the same across all of the states. Why? Because if workers start in California or in Washington and they move across states and the rules are different, they don't know what the standards are. And so that makes it difficult for our migrant farm workers in particular to know what are the protections, what are the rules from state to state, and it's hard for them to keep up with that, especially if the information is not being shared with them when they move from state to state. We also know that there's also different protections across different states. So one of our hopes was that the standards would be met and they would be the same across all of the Western states, and that we would be hopefully a catalyst so that we could change permanent rules to happen across the country. So we wanted the West Coast to lead that direction, in we wanted to be the leaders in that arena. And then finally, we wanted to also discuss that employers and workers currently lack adequate education and training about rules, risks, and protections. And it's not it's not a blaming game, but we find that, you know, different organizations do different kinds of things. And while there's a standard, I think different organizations maybe lack, and some organizations, they raise to the occasion. We have wonderful growers that we work with that are doing excellent work at protecting their workers, but that's not in all places. And what we want is there to be a standard, and we want people to be trained the same, and in the language, and making sure that we address health literacy when we do those trainings. So currently the status of the regulations right now are that we, in Washington State and Oregon, they've implemented permanent heat rules in 2021 in Washington, and in Oregon in 2022. And California already had a heat stress rule. California and Oregon implemented permanent wildfire rules in February of 21, and in Oregon in July of 2022. Washington is in that process. And I know that at the Ag Safety Conference that's happening tomorrow in Wenatchee, they'll be discussing some of those rules that are being proposed. The one thing I wanted to say that is really important is that our work had some impact, because this last summer in Yakima, we were told by the two authors from Labor and Industry that the Western PAC information that we put together was actually used as a model for those two authors to begin to write permanent rules here in the state of Washington. That was the first time we had heard that feedback. And they did in fact tell us that they reached out to the state of Oregon and to the state of California as they were making those permanent rules and writing them up. So that was a good win on behalf of the coalition and the work that we're doing. One of the asks that I have is that when we discuss climate justice and change impacts the health of economic securities of diverse communities, especially those already living in poverty. These communities need to be at the center of the green economy and mitigation of the impacts of climate change. So what I'm saying here is basically, when we think about climate justice, we need to make it personal. We need to see how it impacts us. And we need to have the voice of farm workers and those who work outside as part of the plans when we're talking about climate justice. I think it's essential to have their voices heard in the future talks that we have. And I know that the governor is going to be jumping on here in a few minutes, and I'm really asking him to be thoughtful. I know he's going across the globe talking about this, but I want him to come back home and remember that the people who feed us every single day are the ones who are most impacted by the work that we do. And I wanted to end today by sharing some of the research that we used to do the work that we did and that we continue to work on. We have some local folks from the University of Washington who did some of the work regarding smoke particulate matters and heat. And so I wanted to share this with you. And I also wanted to acknowledge Farm Worker Justice, and here's some of their contact information, and also Northwest Regional Primary Care Association. And I will hand it back over to you, Nina.
Well, first of all, Mary Jo, thank you so much. Extremely informative, especially in respect to farm workers. And you're right, farm workers, we have been fighting for years that farm workers be at the table, especially for climate justice. Your point well taken. They need to be, especially for those that work outside. How can we be pushing policies if farm workers, those that work outside, are not at the table? It's not fair, it's not right. So we need to, on our end, definitely a reminder to keep advocating for that. I want to thank you very much for joining us. I did want you to say, if you could give us I've been asking panelists, do you have the main number for Quincy if anyone wants to get services with your community health center there at Quincy? Do you have that number at hand to say it?
I do. So in Quincy, our phone number here is 509-787-6400. 23. And that one phone number will get you access to everybody in our clinic. And we do speak Spanish and we speak English, and several of our staff speak Mixteco Bajo and Alto.
Excellent. Well, thank you, Mary Jo. Thank you so much for all the incredible work. And I really enjoy working with you. It's an honor.
Thank you. Thank you, Nina.
All right, our next speaker is Marcela Suarez. She's a Promotores Program Manager with CMAR Community Health Centers. She'll be talking today about how CMAR Community Health Centers linguistically and culturally appropriate health care services and health information to the farm worker community in Mount Vernon. Welcome, Marcela.
Thank you, Nina, for the introduction. Good morning, everyone. I'm very excited to share some findings about the social determinants of health research the CMAR Migrant Seasonal Agricultural Worker Promoters Program conducted during 2021 and 2022. This is an ongoing project, and we intend to continue adding relevant information about our local farm worker community.
Thank you, Marcela. Just wanted to ask, if having trouble hearing you, if you could maybe talk a little closer to the.
Excuse me, I cannot hear you, Nina.
I'm having trouble hearing you, so I think it's a sound. Want to make sure that you want to say something, make sure that I can hear you correctly. That way,
Hello?
everyone. Yes.
Can
Okay,
you hear
maybe
me better?
it's a lot better. Yes, if you speak closer to the speaker, that way we can all hear. Thank you. Welcome.
Okay, thank you. The CMAR Community Health Centers Migrant and Seasonal Agriculture Worker Promotores de Salud program is a multidimensional model of community health workers that invests all its efforts and resources in building an environment of trust with the farm worker community in Skagit State and in Washington State's Skagit and Whatcom counties. Promotores de Salud are the front line of this program and act as a bridge between community organizations and the farm worker community by opening access to medical, dental, and mental health services, as well as health education information, particularly relevant to this population. This program also addresses the needs of the farm worker community, empowering them to overcome the unique barriers they face. Skagit and Whatcom counties are home to the majority of Northwest Washington's farm worker population, which comes from Mexico and Guatemala. Nearly 60% of this population in the two counties belong to indigenous communities. Why did the EMSA Promotores program decide to start this research? As a response to very little information about the local farming community and a general lack of knowledge affecting the well-being of our farm workers. In terms of marketing, we have to create products and services aimed at the target customer we want to reach. To do so, we must know our customers' tastes, preference, needs, and therefore adapt our products of service to the target population. Seeing the general need for knowledge of the local agricultural community by local agencies, institutions, and organizations, the EMSA program developed this research to provide tools and relevant information to help these organizations tailor their services for this specific community. We hope that many people reaching out to this community, taking the time to go through this document and thoughtfully embrace changes. The image that you are looking at is the front page of our study. We are the witnesses is the title we choose. Indigenous communities have been in the shadows for a long time. It is in everyone's hands that this changes. Justice is not equity. We need equity in the treatment we give to the members of these communities. The methodology and initial steps of the SDOH project start on November 2020. This ongoing project had 4 main components, which include 2 types of interviews, one with questions addressed to health providers and the other addressed to nurses. A survey covering 9 categories of social determinants of health. Secondary data collection and analysis along with the construction and an interactive online map carried out by 4 interns, and the planning and design of the delivery method for all the information generated by this report. The interview's content was reviewed by a faculty member who is part of the University of Washington Butler School of Nursing and Health Studies, and also the Department of Occupational and Environmental Health Science at the University of Washington School of Public Health. ESA program staff conducted 11 interviews, 5 with medical providers, 1 of those with a specialist, 5 with nurses, and 1 with a healthcare assistant who belongs to the Mixteco community, one of the most representative groups of indigenous Mexican migrant communities in Escalante and Whatcom counties. All the 11 providers we interview are frequently in contact with farm worker patients. A report was made about the findings, common denominators, and relevant issues from the medical perspective, and opportunities to improve the patient experience. You can find the compilation of the information collected during the interviews in an annex to the report. In this project, 10 promotores de salud, 3 community health workers, 3 staff members, and 4 university interns participated. The categories addressed during the investigation were education, economy and resources, housing and transportation, eating habits, mental health, health and lifestyle, substance abuse, safety, and pandemic. Many of them are impacted by external factors beyond the community's control. This is the demographic information of the social determinants of health research participants. We reached 305 farm workers. Of them, 114, the 37% were seasonal farm workers, that are those who have established a home in the area for the last 24 months or more. And 191, the 63% migrant farm workers who migrate to the area during the harvest season. 43% of them were men and 57% women, 24% between 24 and 32 years old, and 58% between 33 and 55 years old. The 89% were Mexican and 6% Guatemalan, 5% from other Central American countries. Of 305 participants, 2% were trilingual, 45 were bilingual in the indigenous language and Spanish, 8% monolingual in Mixteco, and 45% monolingual in Spanish. It's important to remember that 40% of the agricultural community of Escalante and Whatcom counties is not indigenous. One of the 9 categories of the SDO research was education. The 50% of the participants were illiterate, 37% report low level of literacy, and only 10% of them report higher education. However, a total of 65 of 114 participants who had lived in the area for several years, seasonal farm workers, report that their children over the age of 18 have complete higher education. This shows that for the children of workers who establish a permanent home in the area, the opportunity for their children to attend college is greater compared to those who migrate from one place to another, the migrant farm workers. 50% of the participants report being unable to read or write in Spanish or any other language. Additionally, 9% report that they could read and write in their native language. However, we know those who write in their native language do so phonetically. We have seen that 2 or more people writing the same sentence in the same language do so differently. For this reason, writing communication in indigenous languages does not help convey a clear message. Most of the members of these communities don't know the grammatical structure of these languages, which make it not universal writing that everyone can understand. We have heard that some school districts and the DSHS organization send information writing in Mixteco to members of this community. This causes a big problem because organizations assume that the message was delivered unclear. The only thing that this causes is more confusion in communication and misunderstanding. Also, based on the fact that the Mixtec language has multiple variations and some of them are considerably different from each other, people cannot assume that everyone speaks the same variation. So far, we are aware there are 52 variations of the Mixteco language. There are indigenous Aztec and Mayan languages we had found in Escalante and Whatcom counties. The gray color identifies the Mexican states where these indigenous community members come from, and the yellow one, the Guatemalan states. For the new generations, those who are between 20 and 30 years old who migrate to the United States as children and who had the opportunity to attend school in this country, language is not an obstacle. Most of them are trilingual, with English being their second language and Spanish being their third. These are the family members who are and have been helping their parents by interpreting during medical appointments and using other community services. They belong to one culture but grew up in another and have appropriate and integrate both cultures into their life. This made them versatile and very necessary within organizations that offer services to the indigenous communities that live in the area. About the economy and resources, 83% of the participants report working at that moment. 71% work in fields and crops, 80% in packing processing plants, 10% in nurseries, and 1% in activities unrelated to agriculture. 17% were not working at that time. Seasonal farm workers experience fluctuation in the amount of work available to them. The picking season in Escalante and Whatcom counties is typically when the field crop workers earn most of their annual income and are employed. During the colder months known as the low season, they often find themselves unemployed. The work during the low season is reduced to weeding, pruning, watering, planting, and preparing the land. Farm owners require much fewer people. Due to the reduction of work during the low season, many farm worker families have no other choice but to work up to 16 hours each day during the high season to save enough money to cover their expenses during the low season. Teenagers over 14 also work and contribute to the family economy. However, children 12 years of age are allowed to work limit hours with less pay. It is common to see at migrant camp children between 6 and 10 years of age taking care of their younger siblings while their parents and older siblings are working. About resources, answering the question in the past year, which things you need that you could not get, 72% of the answers were related to healthcare services. Also, 11% report a lack of food. With this in mind and the fact that their annual income is often at or below the poverty level, farm worker families need to be informed about local food assistance programs and food banks. We asked about internet access as another resource. 48.5% of participants report having limited internet access and 9.5% had no internet access. Transportation is one of the biggest barriers for many farm workers, especially those who migrate each summer to pick berry crops in Escalante and Whatcom counties. Many migrant farm workers arrive at temporary housing provided by the farm owner in a single vehicle with friends and or family members, leaving most of those who travel in that vehicle during the season without transportation. The farmer community is not a user of local public transportation. The reasons are multiple. Routes are sporadic and bus stops are far from rural areas. Many people will have to walk more than a mile to get to the bus stop. Not to mention that many times they have to go with children. Public service within the transportation system, both at the station and within the buses, is geared toward the English-speaking community. We also have to mention that many times police patrols frequent the areas surrounding the bus station, a situation that intimidates the agricultural community to dare to use this service and discourage the idea of learning to navigate the local public transportation system. Survey respondents report that lack of transportation has prevented them from getting to 20% medical, dental, mental health appointments, 90% shopping for essential goods, 17% go to work, and 10% attend community gatherings. Housing is a fundamental human right, which should fulfill the premise of being a safe and comfortable place where we can rest, protect from the weather, protect from the dangers of the street, and a place we share with our families, our loved ones. It is natural for people to develop a sense of belonging with this space called home, not only because personal belongings are found there, but also family memories. For this reason, not having a place to call home ends up negatively affecting a person's mental, emotional, and physical health. The relationship between physical space and what that physical space represents has a very big implication for the stability of a person through their life. The high mobility of migrant workers forces them to share their homes with other people who do not belong to their nuclear family. Living in overcrowded conditions increases the risk of creating family tensions, limiting privacy, and leading to depression, anxiety, and stress, to the point of reaching domestic violence, triggering many other mental health issues that affect the children. The overcrowded conditions also increases the risk of exposure to contagious infections, diseases, virus, sexual abuse, violence, and harassment. 44% of respondents live in farm worker housing. We want to ask about their eating habits. 46% of the surveyed respondents answered they do not have a specific time to eat. Often, especially those who work in the fields, prefer to finish their assigned tasks before taking a break to eat and or hydrate. For many farm workers, it is more convenient in economic terms to avoid these time breaks because that means less money in their pocket, especially when they work by contract or by pieces. Here, the number of pounds of fruit that is picked is very relevant. Harvest time is limited, and it is the only opportunity during the year that migrant farm workers have to increase their income, which will help them sustain themselves through those months when the amount of work decreased considerably. There are other reasons why farm workers don't take their meal times regularly or take breaks more often. Also, the long hours of work often lead the farm workers to choose foods that give a feeling of fullness, but with low nutritional content. The quality of the food consumed becomes another cause of health problems. Nutrition, hydration, and active breaks during working hours determine factors in the health of human beings. Thinking about the long hours of exposure to the sun and the answers about how many times a day they hydrate are very worrying. 57% report drinking less than 4 glasses of water a day, and 3 participants say they don't drink water while working because this makes them go to the bathroom, and the bathroom facilities are often far from the field trenches where they work. Work in the fields is physically demanding, so it is necessary to obtain at least 8 hours of uninterrupted sleep to restore energy. It is common to hear from members of the community that they don't get the required hours of sleep because their days are full of work and chores at home and family interaction. Other comments also include financial and or family concerns. In many of these families, everyone sleeps in the same room, making it difficult to get a deep and restful sleep. Although farm workers burn many calories walking through the field trenches in high temperatures, this activity is not done with proper clothing or shoes that allow them to transpire and with regular hydration. Clearly, there is no encouragement to do healthy physical activity because the body is exhausted and abused. Agriculture workers are part of the population with low access to primary care health services. Low access is due to the cost of the service. Many farm workers either do not have health insurance because they are not eligible, and some are unaware of programs that can help them use health services. 70% of those surveyed report not having health insurance, and 2% had temporary health insurance due to pregnancy. The cost of health services discourage many from seeking routine preventive health appointments. This can often result in the community members seeking health services when they can no longer handle the discomfort or pain, which can be more expensive having to go to the ER. Indigenous beliefs around health, wellness, and disease are rooted in ancient Mayan and Aztec belief traditions that nature, society, the spirit world, and the cosmos are all interconnected. Heat illnesses are believed to cause excess of heat in the body, and cold illnesses are caused by excessive temperature loss. The key for good health is to balance heat and cold. The hot elements are associated with the sun, the sky, the masculine, order, light, and life. The cold elements are associated with the moon, the earth, the feminine, darkness, and death. Both are necessary for life. Like a plant, it needs the heat and light of the sun and the cold forces of the earth. Many illnesses are also attributed to supernatural causes such as evil spirits, the evil eye, and violation of taboos. Those who have lived for years in the US have learned to look to both Western medicine and their traditional healing practices. Other migrants or newcomers still rely heavily on their own traditions of seeking out healers. Local organizations and agencies serving members of this community have a responsibility to provide the support they need to navigate the system. This involves helping them fill out the application forms, providing interpretation services in their native language, and giving them the option to do any process to acquire services in person and by phone. Some members of the community require extra help. In these cases, one-to-one guidance is critical for these individuals to be able to use the general community services, especially in healthcare services. Preventive health is not part of the culture of indigenous communities. Their perspective on this is different. As a consequence, routine visits are not a priority for them. 10% of respondents report that the last time they saw a doctor was 4 or more years ago, and 5% have never seen a doctor. 50% of respondents report that the last time they saw a dentist was 4 or more years ago, and 18 have never seen a dentist. 7% surveyed responded that in the last year they have used prescription drugs in a way that they should not be used. We had heard from some members of the community who have received medical prescription for pain pills, which in addition to relieving pain, help them experience a sense of happiness, forget about problems, and better resist physical exertion, making work days less difficult. For this reason, they want to continue taking them permanently. Heavy lifting, prolonged kneeling, constant bending and twisting, and repetitive movements all lead to musculoskeletal and traumatic injuries. Between 2008 and 2010, 50% of all contract farm worker injuries were classified as strains or sprains. It is understandable why farm workers use pain medication more and more frequently. About alcohol consumption, respondents were asked, how many times in the last 12 months had you had 4 or more alcoholic drinks per day? 30 people report doing it monthly, 50 weekly to daily. Cultural traditions and social attitudes towards alcohol, as well as the norms and belief system of an ethnic group, are reflected in the way individuals drink. This determines what is considered acceptable behavior, both in the family context as well as in the community and in social interaction. Culturally, the Latino community has weakened social habits where most of the time alcohol is consumed. The alcohol consumption is normalized depending on gender. It is not bad for a man to get drunk, but it's very frowned upon for a woman to do so. Then we would say that there is a cultural background in the Latino indigenous non-Indigenous communities related to alcohol consumption. About drug use, in the social determinants of health survey, 6 people report having used marijuana in the past year, and 7 people report having used any of these drugs: heroin, cocaine, amphetamine, hallucinants, or others. A category was included about safety in family relationships and home and at work. Some of the questions include addressing safety in family relationships where, in the last year, has someone in your family physically hurt, insulted, or threatened you? 29.5% of the participants answered this question affirmatively, 41% men and 59% women. In the last year, have you been afraid of your partner or ex-partner? 5% of the participants answered this question affirmatively, 43% men and 57% women. Intrafamily security is made up of a series of rules and behaviors aimed at minimizing, controlling, and neutralizing situations of violence that all family members should fulfill. However, these rules and behaviors are not taught and therefore are not practiced, nor do they give the importance that this requires. For this reason, by the ignorance of what is good behavior and based on example, which is the best way to teach, is that the agricultural worker is frequently involved in situations of violence and interfamily insecurity. We mentioned the example because violence is a present element almost normalized, and that all family members end up accepting, not because they think it is okay, but because the fear generated through these behaviors invalidates the defense action, making the situation something that has to be endured, especially for women. Working in male-dominated environments, and in some cases being undocumented, exposes female farm workers to sexual harassment and even worse, rape. The fact of having language barriers and living in isolation prevents them from making use of their rights. One of the questions in the SDOH survey was formulated as follows. Stress means a situation in which a person feels tense, restless, nervous, or anxious, or cannot sleep at night because of worry or too many things on their minds. Do you feel this kind of stress these days? Survey participants answered. Some days 33%, many days 6%. Discrimination, extreme poverty, languages, and all the challenges associated with the condition of agricultural work, such as exposure to the element, dangerous work, inadequate housing, social isolation, and lack of transportation, among others, made the work of the farm worker full of insecure areas. The life of the agricultural worker is a life of many physical efforts, sacrifices, long hours of work, little rest, lack of entertainment, very basic food, lack of care, lack of preventive health, no right to vacation, economic restrictions, among many others, factors that lead them to suffer from depression and anxiety. The last category we addressed was the pandemic. 78% of those surveyed report having received the COVID-19 vaccine, and 22% answered that they had not. Some of the reasons they mentioned why they do not get the vaccine were because of fear, afraid to die. 11% prefer not answer. Government institutions established preventive health measures for the population, including farm workers. Unfortunately, the housing condition of agricultural workers don't have the characteristics to be able to fully comply with preventive measures such as social distancing. It is a contradictory to think that farm workers are essential workers were even more vulnerable in the pandemic than the rest of the population called essential workers. Before, it was difficult for them to deal with so many barriers. Now, they had to expose themselves without having personal protective equipment at their disposal. Often transporting with many people in a single vehicle, and to this was added that they had to share very small spaces in their homes. The economic factor was also affected because the students had to have school at home. In a family with 2 working parents, only one could work, thus reducing their income by half. The roots of vaccine insecure for the vast majority of indigenous farm workers we have reached go beyond this pandemic, starting from the simple fact that in their languages, the concept of pandemic or vaccine doesn't exist. Things will not change overnight. This is more than just hesitancy about vaccine. It is about language, culture, worldview, collective trauma, and current and past barriers. Thanks to the pandemic, many local organizations have become actively involved with the farm worker community. The Promotores de Salud have worked with public health in different initiatives, indigenous language translation, embedded in videos used to guide the community on how to navigate the COVID-19 testing and vaccination sites, reaching the community and non-exclusive COVID vaccination events, and bringing resources to Latino neighborhoods. It
Wonderful.
was a lot of information that is not easy to absorb in 30 minutes. I know if you
Thank you, Marcela. It was helpful.
Thank you.
Thank you, Marcela. I want to thank CMAR Community Health. I want to thank your efforts doing this important work. And I think this presentation was wonderful. If we have any questions, we'll be sending them to you, and maybe we could send some answers back to some of our folks that have been asking questions. So thank you so much.
Thank you.
All right. Before we get to our next speaker, I want to share some updates. As you know, I mentioned earlier that we sent a delegation in person in Olympia right now, and also having virtual appointments with legislators. Great meetings, great outcomes, receiving great feedback. Some of the talking points we're sharing with legislators is definitely the shortage of behavioral health staff and how the legislature is going to address it. We need to do a lot more, have much more aggressive efforts to deal with this. Also, small businesses, the importance of our Latino small businesses play in the economy. We've been having great conversations with legislators about the challenges, but we also are asking for them to support more access to capital and operating dollars. Definitely during the pandemic, small businesses were definitely impacted. The next would be talking to legislators about policies that impact K through 12, our kids. And, we are seeing an increase of suspensions and expulsions of kids around the state. We want that to be addressed. We know that it's at a school level and school district level, but we want our legislators to know that it is happening in some of the rural areas, and not just rural areas in Western Washington, in the urban areas as well. And then last, we have been talking about addressing gun violence in our communities and creating real solutions that's going to make an impact. Thank you. So now moving to our next guest speaker, we have Secretary Irma Meneses. She's actually the Secretary of Washington State Department of Social and Health Services. She'll be talking today about addressing food insecurity solutions. Welcome, Secretary. Glad to have you.
Good morning, I guess. Yes, thank you for having me today. Wow, what an honor to be here with all of you, and a true pleasure and definitely a privilege, right? I just wanted to share a little bit about me as a fellow Latina. I am of Nicaraguan descent, came here as an immigrant, as a child, like many of you maybe who are immigrants. Grew up in the Bay Area, but went to law school in Oregon, and have done a lot of various things in my career in executive roles. I was asked, why did you come to DSHS, or the state of Washington? Well, first of all, I've been living in the state for quite some time. But regardless of where I've been working, I've been living in Southern Washington for the past 30 years almost. But my goal, folks, is, like many of you, is to break the cycles of poverty, right? To advocate for justice and to strengthen the health and vitality of communities throughout by providing access to critical services, healthcare, human services, and many other opportunities, including education, which is a key to breaking poverty and advancement, as we all know in this space. It's one of the reasons I came here. And among the things that we do with that is it, as I think most of you are familiar with DSHS, but I'll just give you a high level. We serve approximately almost 3 million people, and about 20% of those 3 million people are Latinos, Latinx community members. That's a big population, especially because there's only about 1 million of Washingtonians are Latinx or Hispanic or identify as such. Yet at DSHS, we serve about 21%. That's a big number. Anyway, as I was saying, we do a lot. We serve a lot of folks. We have over 17,000 employees. We provide services around behavioral health, developmental disabilities, vocational rehab, aging and long-term care, Medicaid pathways based on age and disability, and of course, public benefits such as food security and cash assistance, otherwise known as SNAP and TANF, funded by USAID. And that's a big component for our population in Washington, and definitely for the 21% Latinos or Latinx. Some of you know Tony Bowie, maybe. He is the Assistant Secretary for the Economic Services Administration, who is in charge of just the public benefits, but we have the other assistant secretaries as well. I want to show you, if you don't mind, what I call the DSHS house. And my colleague Brenda is going to pull it up for us in a second. All right. So when I came to DSHS, it's a little over a year ago now, I found that a lot of the agencies in the state of Washington are quite siloed. And even within DSHS, as big as it is, there were a lot of silos. One of the goals that we have is to bring us together as one house, and I call it the House of Human Services. And obviously, some of the basic foundation of this house, like the basic foundation of the house you live in, has to be strong, right? That cement has to be really grounded. Well, at DSHS, one of our basic foundations is to modernize our IT infrastructure. Many of you know that the state has been a little bit slower than not in modernizing all of our IT infrastructure. So that's a big component of our key priority here at DSHS, is to do that. But once you do that, the other main basic foundation is to have staffing stabilization. And folks, that can't happen if we are not a proactive equity and anti-racist agency. I mention that again because I know that this audience understands the impacts of racial equity and anti-racism. I think if you're a Latinx member of the community, you have experienced racism. You have experienced othering, right, rather than belonging. And so at DSHS, it's one of my key priorities of that foundation is to bring responsibility and accountability to every member of the House, regardless of which administration we're talking about, whether it's economic services, voc rehab, DDA, BHA, or aging long-term care, right? Regardless of what part of the House people work for, that anti-racism has to be a foundation. So we built a house, an Office of Justice and Civil Rights to help launch along as a partner with the Office of Equity, and to make sure that that accountability goes beyond just talk, but rather action. It's really important for me as a Latina, as a woman, and as a mother, right? To end as a leader of this organization, and also hopefully as a leader in the state of Washington. We can't do the work that we do regarding homelessness or housing or behavioral health or anything else. We can't do that poverty reduction unless we have that basic foundation of staffing stabilization through an organization of anti-racism and so forth. And you can't get to the basics of cash assistance or nutrition, for example, food security, those services without that. Anyway, so that's a little bit about me. And this was just an opportunity to say hello to you, to let you know that I'm available as a colleague, as a fellow Latina, and as a friend. I'm here for you, and I'd love to hear from any of you, any questions, a word of inspiration maybe by some of you. I would love to hear, if you don't mind. I know there's a lot of you here, but I welcome anybody who would like to say anything.
Well, thank you, Secretary. For the purpose of this virtual and all the behind the scenes work, it's hard we don't have the ability to have participants ask questions, but I did want to ask you a few. First of all, thank you for really caring about this. As the numbers that you mentioned, 21%, that's really high. That was really data that that we were not aware of. And on this virtual event, there's a lot of incredible leaders that we will come together and support you any way we can as you're working through these changes. With that data though, what do you think what is your timeline of, first of all, the IT enhancement? I know that takes time.
So IT enhancements are ongoing, right? And just because you enhance today doesn't mean that you don't enhance tomorrow. Digital modernization has to be constant all the time. But the major digital and modernization that we're trying to do is a big lift. For example, we're trying to have one platform called an integrated eligibility system platform, where anybody wanting to apply for services, instead of going through 3 different agencies, such as Healthcare Authority and DCYF or DSHS for various services, they go to one platform, they input their information there, and then behind the scenes, the system will hopefully track all the kinds of services that this person might need or want. Anyway, that system is going to take a few years, but we're in the very much in the development with our sister agencies. That could take up to 3 years, maybe even more. At the same time, there are what I call tugboats happening as we speak, modernizations that impact us immediately, from uploading some of our documents, meaning the client uploading their documents, to using their phones. I understand from some of our clients that the systems have been so antiquated that they've had to go through phone systems and work and wait very long times on the phone. Well, and we're not the only state that has these antiquated problems, but regardless, we have to do, for the state of Washington anyway, we have to do what we can. So there are band-aids that are happening right now with those particular telephony systems and so forth. It's an ongoing, that's a really good question.
The last question would be, our biggest concern, and I know you know this, is working families needing food stamp assistance, right, TANF? And because they don't have a job, but then they get a job, and then right as soon as their income is reported, they lose those benefits. I mean, on average, a family that of 4 or 2, it doesn't matter size, it takes time to build your, equity over time when you get a job. This is extremely concerning. Any thoughts? I know there's been a movement, but how we can change that, allocating more time for a family, to get back on their feet. That first paycheck, goes to grocery bills. That's the reality. And so any thoughts about that and how you will?
Absolutely. So first of all, those income eligibility criteria are federal standards, they're not state. However, to your specific point, there actually is a bill right now to allow a family continue getting the income through state monies for another few months, I believe up to 6 months. And even though that, for example, even though they're no longer qualified in January because they got that job, the goal is to keep on giving them the income for a few more months so that they stabilize. Otherwise, that routine poverty cycle continues, right? As you pointed out, Nina. So that's a big one for us. We're working right now. Our Economic Services Administration is working very diligently on that.
Okay.
With the legislature.
Okay, great. I guess the last question would be, under DSHS, does child support fall under that as well?
Mm-hmm. Mm-hmm. Yeah.
And my understanding is, so you mentioned, I'd like to see that slide one more time, but just to get a quick overview, but it's okay.
Your
I think,
house? You want to see our house?
yeah, the house, yes, if we could see the house. One more time. So if all our stakeholders on this call can see that look how important, this agency is in services, aging and long-term support, behavioral health administration. I did not know you managed Division of Vocational Rehabilitation. So that's really important. I'm really pleased to hear about the proactive equity and anti-racist, the efforts that you're doing, but definitely I didn't realize how many programs you have. So this was really great that you joined us today, Secretary.
You're welcome. Yes, we are this largest agency. It used to be bigger. DCYF used to be part of this healthcare authority, but I understand it about 3 to 5 years ago, those were made separate entities, but it still is very, very large, very comprehensive. We're doing a lot. And quite often people only hear the negativity. They don't hear about all the really good work that we're doing, impacting, like I said, almost 3 million people, specifically with food and cash assistance, which is food security, right, is critical to our existence.
Right. Well, thank you, Secretary, for your time today. Wonderful to have you join us, and we will stay in touch.
Thank you. Be well.
You too. All right, our last presenter before our special program at 12 p.m., and then we'll continue after, is Angie Hinojos. She is the chair the chair of the Commission of Hispanic Affairs. Angie, welcome. Glad to have you.
Thank you, Nina. Thank you for the invitation. Good morning and welcome to my beloved Latino community from across this beautiful state of Washington. It is an honor to be with you here today on a day when our Latino community is gathered together to meet with Governor Inslee and our state representatives to celebrate our communal voice. My name is Angie Hinojos. I'm the chair of the Washington State Commission on Hispanic Affairs. I want you to know your commissioners are listening to you, and we carry your voice forward in guiding meaningful policy on behalf of our communities. With your input, your commissioners bring their experiences to the table to help address some of the most pressing challenges and priorities that we face. Commissioners are experienced in the areas of education, labor, immigration, business, law, justice, and policymaking. Our executive director and her staff ensure that the work of the commission is effective and consistent over time. Together, we represent over 1 million proud Latinos in this state, and we're amplifying our community's voice so that your priorities reach policymakers. We are focused on mapping our communities across the state, identifying common priorities, and ensuring accurate counts for equitable outcomes. Commissioners live in all areas of the state. Reach out to us. We will always be glad to connect, and we will likely be meeting in person in a location near you in this coming year. And so we invite you to join us on location. Latinos in Washington State have much to celebrate. We celebrate our beautiful cultures and traditions, our families, our communities. We celebrate our precious children. 1 in 4 students in Washington State are Latino. We celebrate our successes. Latino small business support the economy in large cities and in small towns and provide needed jobs, goods, and services in our communities. And we celebrate our leaders. You will hear from many of our elected representatives today. We also celebrate our leaders in industry, in the arts, in business, health, service, and education. We celebrate our grassroots community leaders and our incredible youth leaders, as well as our elders who share their wisdom and knowledge. We celebrate our innovative spirit. We are creative, we are hardworking, and we persevere even through adversity. We are resilient, though we should not have to work twice as hard for half as much. We celebrate our history. Our children learn the history that they study at school, and at home they learn our truths, the ones that we must tell them so that when they go out into the world, they are prepared. In our learning, we're eager to acknowledge the accomplishments of Latinos who have contributed and continue to contribute to the building of this country and this state. Latinos have a rich history of service in our state. Many of our family members, including my own father, served this country in the armed forces. Our Latino veterans deserve our recognition and respect for their service. My father followed the memory of his older brother to Los Angeles. He was an uncertain teenager dreaming the same dream that so many others before him carried in their hearts. The search for opportunity, the chance to contribute, to learn, to have choices in determining how his life might unfold. Our community's contributions don't always see the pages of the history books. Did you know that in the 1790s, Mexicans produced among the first in-depth topographical and scientific studies that were shared outside of this region? And those studies were of Washington State, what would become Washington State. They created an ecological catalog of hundreds of plants, animals, and birds, as well as the first detailed landscapes to be extensively shared. Did you know that in the 1850s, the mule packing industry here in Washington, operated by Mexicans, opened up the region to mass distribution of goods and established commercial transportation routes in Eastern Washington that were essential to the growth of the state? Later, starting in the 1940s, Mexicans would begin a long history of contributing to the agricultural and railroad industries. Since that time, Latinos in our state have grown to include Central Americans and South Americans and others. We are a group comprised of a multitude of identities. We have been instrumental in creating social change, as well as cultural change. Wherever we live, our communities adopt our food, culture, and music, and we know why, because it's amazing. We celebrate our combined history, our hard work, and pride in who we are. We also know that we have been traversing through dark years, capped by the pandemic, where many in our communities have experienced grave losses. We have been moving through a treacherous night with no light to guide our path, and with our sorrows gently settled around our shoulders, a reminder that we bear a grief that will never leave us. We have lost jobs, we have lost homes, we have lost loved ones. For many, cherished dreams that we held have been pushed into the dirt at our feet, and yet we still nurture a seed of hope. We tend it quietly, starting over, sprinkling water from our palms, looking for a day when that seed will sprout from the warm earth and grow into something brilliant, and it will. In those times when there was nothing, in the dark days during the pandemic and before the pandemic and even now, I saw our people sharing food with strangers, cradling each other's babies, consoling the ill and forgotten, and enfolding into their arms those who had even less. I saw children caring for grandparents who no longer recognized them. I saw our elders guiding lost teens into adulthood. I saw adults scraping every day to salvage pieces of their former lives, forced to make choices that were designed to break us: food or medicine, a home or an education. But we don't break. We work, we study, we sing, we love, we celebrate. We all mostly want the same things: financial stability, a safe place to call home, healthy food, access to doctors, and an education for ourselves and for our children. We want representation in government and in our institutions. We not only want to have a presence, but we also want to be part of decision-making so that we can be the authors of our own destinies and enjoy the same rewards that others have been granted. We must question systems that do not work for us and that sometimes even work against us. We must carry on the work that others before us have begun to create systems that respect the needs of our communities in ways that resonate with us. I'm proud to live in Washington State, where we value our communities, where we take care of each other, from creating new mechanisms to provide supports for undocumented individuals, to protection of civil rights. We value justice. And in Washington, we work to create safe and inclusive environments for all. In that regard, each of us has a responsibility to uphold. If you are eligible to vote, register and vote. Exercise your power and encourage others to do the same. For our youth, seek opportunities to further your education. Enroll in the trades, in community and technical colleges, in university. Push your boundaries. Share your brilliance with the world because we see your brilliance. Join boards and commissions and be active in your communities. We need your voice. Many of us carry a vision of a future where we pursue our dreams without restraint and where we reach our full potential. What if we shared a single vision? What if we thought of every child as our own? What if we thought of every elder as a beloved parent or grandparent? Every neighbor as a brother, sister, or sibling? What if we believed that we could climb our mountains together, lifting one another as we climb, gently pushing the person ahead of us, our hand on their back, and carrying those who are tired, and convincing those among us who want to go back that from the highest peak, we will see far out over the landscape, and we will be able to create a map for others to follow, just as our ancestors helped map this state. A map for others to refine, for others to define, or for others to use to lead new expeditions to places we haven't thought of yet. What is our collective vision for the future? Empowerment, self-determination, increased representation, equitable access to opportunity. If we are to achieve a shared vision, we must do it together, in unity, in solidarity. What if we dreamed together, planned together, excelled together, and celebrated together? The time is now. Ya es tiempo. Thank you. Gracias.
Thank you, Angie. Very inspiring. I did want, before I let you go, could you share how stakeholders can reach the commission?
Absolutely. Thank you, Nina. The commission has a website and is online. We all have emails, and as well as our executive director, so you can reach out to the executive director or to commissioners individually. Also, you can see the meeting agendas online, and we really welcome participation from community in our commission meetings. And there's always time for public comment. Those are open public meetings. We love to see community be part of that.
Excellent. And the commissioner's role, final question would be, you each of you are appointed from the governor, correct? And
Correct.
and then you share information with the governor. Could you tell us a little bit more about that?
Yes, thank you. Well, so we are really focused right now on ensuring that we are first of all, listening to community and hearing that community voice and community priorities. Because it's everybody can have their thoughts, but we really need to ensure that we're listening to community voice and then amplifying the priorities that we're hearing from around the state. So part of that is mapping and understanding where our communities are around the state, keeping strong channels of communication open, and then utilizing that information to be able to guide policy and to be able to really ensure that the voice of our community is being heard and is showing up in the work that we're doing in policy making at the state level.
Right, and then you do, I know the commissioners around the state, I know we've been partners with Latino Civic Alliance and CHA for many years, great history together. You do have, also talking to the governor, you meet with the governor as well. I know he's going to join us here in a little bit for our special program he does every year, but I definitely want to make sure that we know how to reach you. And so again, the website is, I think we have it in the chat. It's www.cha.wa.commissioners, I believe. Right.
.gov. Yes,
Okay.
cha.wa.gov. And on that website, you'll find a lot of great information and resources, information about legislation that's happening right now, information on where our meetings are, information on some local resources and data. And then once again, we welcome those emails and phone calls, and it's a priority really to keep communication open across the state.
Thank you. Well, Angie, thank you so much for joining us
Thank
today.
you, Nina.
Inspiring. Have a good day.
Thank you. Okay.
All right, everyone. So now we will start our special program, and we're in for a treat. It will play out this way. Our Mount Vernon Mariachi performer in Flamenco, they'll be school district, Mount Vernon School District. They are excited. They're going to be performing. And then we will be honoring our first 2023 Latino Civic Award recipient, Councilwoman Iris Carias. So how are we, Mount Vernon? I think they're getting them ready to go live and perform for us. While we're waiting, I can go ahead and post some bills that we have been advocating for today and ongoing, and education bills that are important to us, K through 12, would be House Bill 1228. That is a dual language, multi-language, multiliterate Washington dual language and tribal language education bill that Representative Cortez mentioned. That bill has been led by Representative Lillian Ortiz for a very long time. We need to help advocate and get it out of the committee this week by Friday. So if you could please contact your legislator and ask them to move and support House Bill 1228. The other bill is Senate Bill 5423, due pass. It's providing statement of student rights. It will help more of our kids know and understand the student rights in the school districts. That's an important bill. Again, that's Senate Bill 5423. Another bill that we are advocating for is House Bill 1479. It would minimize student restraint isolation. We want to end our kids or any child in a situation to be isolated alone. There has to be some ways to handle the situation and that's more humane. So that bill again is House Bill 1479. Another bill is clarifying requirements governing and withholding high school diplomas. That's House Bill 1536. All right. And do we have our Mount Vernon performers?
Let's see. Mount Vernon Mariachis, are you ready? Say if not, let's go ahead and hear from Chief Justice Gonzalez if he's ready, and we'll come back to our mariachi entertainment after that.
Well, first, let me do the honor of introducing Chief Justice Steve Gonzalez. First, welcome. Incredibly proud that you are in the court. I'm just so happy to see you and that you took time to join us today. So, thank you for being here.
Thank you, Nina Martinez, for the introduction and for the invitation to be here. It's a pleasure. We're getting ready here on the Supreme Court for our traveling court, which we do 3 times a year. We'll be in Seattle at Seattle University. So I'm on my way out as soon as we finish with this discussion today. My name is Stephen Gonzalez. I am the Chief Justice of the Washington Supreme Court. I've been the chief now for 2 years, the first Latino, in fact, the first person of color ever to be chief of our highest court in the state of Washington. It's an honor to have all of you here as you advocate, and I'll share, I know I just have 2 minutes, and I promise to stay within that, a poem from my grandfather.
Oh,
Soy
nice.
el badajo de mi propia campana, doblando dignidad para todos. I am the tongue of my own bell, ringing dignity for all. Each and every one of you advocating for your community is a bell with a tongue that you can ring loud and clear, not just for yourself, but for others. In fact, for everyone in the state of Washington. Thank you for that advocacy. It's great to be a small part of today. So proud of all of you. And thank you for the invitation to be here.
Thank you, Chief Justice Gonzalez. So proud of you too. Thank you for joining us. Well, now we see that, and I did want to say that Chief Justice Gonzalez was a mariachi himself. And so once in Latino Legislative Day, he actually wore his outfit. So it was really wonderful. So I see our Mount Vernon School District Mariachi are joining us.
Yes.
Hello.
Hello,
So
everyone. How's everyone on Latino Legislative Day? Thank you again for this great invitation. I brought you a beautiful, we're going to be doing a couple songs to kick things off, because what's a legislative day without dancing and music, right? And so one of the most beautiful things is we're going to see folklorical music. We're going to see our folklorical dancers that are here performing today. We're in beautiful Mount Vernon, and are you guys ready to see them to dance?
we definitely are. We're
All right,
excited.
here we go. Let me see. There we go.
Wonderful, wonderful.
Sorry. So, otra, sí or no?
Yes, yes,
Oh,
one more. Yes, please. We'd like to see one more.
Let's do more. Let's go more to 2 a.m., right? Okay, here we go. The Mount Vernon High School Folklorico. Let's go. Wow.
Wonderful. Congratulations. Thank you so much. I'd like to see
Isn't
the,
that amazing?
it was. Can we see the kids? Can y'all come up closer to the camera and say hello? We want to see your faces. Hi, everyone. Hi, everyone. Hello. How are you? You looked so beautiful, all of you dancing. It was a wonderful performance. Thank you so much. Thank you. So Ramon, I was hoping you had a special guest there with our
Special guest. I also have our superintendent that's here today, Dr.
Okay.
Vivanco, that's here. And we have a special honor for someone. No, stay up here, stay up here. We got to cheer on our.
Yes,
hometown
everyone
person. No,
stand.
they-
Yes, everyone's gonna
I'm tired,
stand.
But I said, no, not for this special lady that we have here. I want to introduce our superintendent. This is our superintendent, Dr. Vivanco. And
Hello.
we have a special honoree that we're going to be honoring, and we want to
Yes.
thank Latino Civic Alliance and Latino Legislative Day for this. And you gonna say hi, Brooklyn? There we go.
Hello, that's better. A little lower, that's right. So
Yes.
Ramon, I'd like to go ahead and make this wonderful acknowledgement. Is Councilwoman Iris Garias there?
Yes.
Can we see her?
Yes, she's coming right now. She's too busy taking selfies with us, you know? So we're really excited. I'm gonna turn it over
Yes.
to wonderful Mount Vernon City Council woman and also our migrant outreach coordinator.
Right, thank you. And if you could put the camera a little lower so we can see the award. And can you move the camera down a little more? There you go. Perfect. So, Councilwoman Acarias, I just want to say congratulations. How wonderful it is to honor you today. You are being recognized for significant contribution in leadership and achievement for becoming the first Latina to sit on the Mount Vernon City Council. In recognition of your dedicated advocacy, civic engagement, and service to others that is substantial in perseverance, integrity, heroic, and time commitment. You are seen as a powerful woman and leader in Mount Vernon, and today we just wanted to celebrate you and honor you. So on behalf of Latino Civic Alliance, we are extending this award. It's a glass award to you, and we would love, yay! So many people are watching. So many people are watching. And if you could say a few remarks, it'd be wonderful.
Good morning, everyone. Thank you, Nina, for and all your staff putting your eyes in our community here in Mount Vernon. This is not just for me, it's from all of us. The whole community works together and just to get results for our in behalf of our families and our students and most of our community. Thank you very much, and I am honored to be here accepting this this award in name of all my students here, Dr. Vivanco, Mr. Rivera, and Belen. And also I would like to send a special thanks for my other colleague who's Latino and is in the table of City Council, Juan Morales. Both of us, we are the voice here in this community, bringing the voices together for our community. And this is amazing, and just to live in a little touch on the board and say how much we can do more, and working together in coalition and collaboration, we can get more results and beneficial of our students, families, and the whole community. Thank you very much.
Thank you. And Councilor, you were going to say some remarks in Spanish. Did you want to speak just a few things in Spanish to everyone?
Muchísimas gracias. Es un honor para mí estar aquí con ustedes y haber sido nominada y recibir este premio por parte de LAC y con toda nuestra comunidad aquí. Esto no solamente son frutos míos, son frutos de toda la comunidad trabajando juntos, trayendo nuestras fuerzas para trabajar en beneficio de nuestros estudiantes, nuestras familias, sobre todo aquí en Escalles, nuestras familias que trabajan en la agricultura son una fuerza valiosa para no solamente para esta comunidad, sino para el país entero, porque formamos parte de la economía, donde traemos todas nuestras mejores voluntades y fuerzas para trabajar y hacer de estos trabajos dignos, traer para nuestros hijos el orgullo de saber de dónde vienen, quiénes somos y qué es lo que hacemos, cómo contribuimos como sociedad. Muchísimas gracias, y también decía que quiero extender mi saludo a mi colega Juan Morales, que es otro latino que está en el concilio, y que todos juntos en voces unidas y con fuerzas vamos a llegar lejos. Y estamos haciendo un buen trabajo en la comunidad, pero todavía podemos hacer mucho más en beneficio de todas nuestras fuerzas comunitarias, familias, estudiantes y compañeros de trabajo. Aquí a la par del doctor Vivanco, nuestro superintendente, nuestro orgullo latino, como también el señor Rivera y nuestros estudiantes que han alegrado con su presencia, con su colorido, con su energía. Y estamos aquí precisamente dando gracias por todos estos reconocimientos. Gracias por poner sus ojos en Mount Vernon y gracias por tomarnos en consideración por el trabajo que realizamos en equipo, que somos un gran equipo. Muchísimas gracias y que Dios les bendiga.
Thank you, Councilwoman Iris. I see Governor Inslee has joined us. Do all the kids want to say hello to Governor Inslee?
Yeah, come in. We got to say hello. Hi, Governor Inslee. How are you?
Next year we'll be in person, Governor. We'll come see you.
We're coming. We're coming to see you, Governor Inslee.
Governor Enzi, we can't hear you. Can you unmute your, there you go.
Am I coming in there now?
Yes, we can hear you
Good.
now.
All right.
Hey, Governor Inslee, long time no see, right?
Well, listen, I already had the highlight of my day to listen to the Mount Vernon Mariachi Band. It's all downhill from here.
All right, everyone. Kids, you want to say bye to Governor Inslee?
Hasta luego. Thank you, friends.
Well, Governor Enzi, thank you for joining us for 2023 Latino Legislative Day. Hopefully we've created a hybrid, but we will be coming in. We have a delegation now in Olympia, but next year we hope to have it all in person so you can come join us. So want to thank you so much for your leadership in Washington State, especially during the COVID pandemic. You were one of the governors in the country that was strong and stayed firm in making sure that Washingtonians were safe. So I want to thank you so much for your courage and leadership.
Well, thanks back to everybody on this call, because I know everybody in one way or another was a leader in the effort against COVID. I think we worked really well together in getting as many vaccinations accessibly and treatment into the Latinx community. Thank you for your leadership. It was a very difficult time, and now we've, we're not through it totally. We still helpful to get vaccinations alike, but we're hopefully over the worst of it. So thank you for everybody's leadership. Thank you for all of the leadership we're getting from this community. You know, we just got David Puente, our new director of our Veterans Affairs Agency. We have Ramon do this tremendous work. And now you're here lobbying legislators. Thank you for doing this work. It's extremely important. You know, when this community works together, it can just do magnificent things. I was at the Parque Padrinas Park in Wenatchee a few months ago and saw what the community was able to put together there. It's just thrilling to me. So you're making a contribution for the whole state, not just Latinx folks. And I want to thank you for all of the leadership you've displayed. You know, I think we've had some mutual success in the last couple of years. I was really happy we were able to extend, for instance, maternal health benefits to folks for a longer period of time. We know how challenging that is, and to be able to give longer Medicaid coverage to moms was a success. And I know this group helped us get that through. We know that we got work to do now. In the future, though, we're not done, right? So we've had some successes, but we certainly are not done. Let me, if I can, talk about a few things that I really hope we can do together. First, in youth violence prevention. You know, I think there's a lot of things we can do in a positive way to reduce the scourge of youth violence. And when I was in Yakima and saw the WAY program, if people were familiar with this, that really connects young people in a peer-to-peer based model to get people away from these gangs and give them a future. It is shown statistically to show a reduction of youth violence. And we are trying to extend that and expand that across the state of Washington. So I hope that you think that's a good idea. And I hope that we can ask legislators to join us on that. I think there's things we can do in gun safety. You know, I have 3 bills this year to reduce gun violence, to ban assault weapons, to require people to have safety training before they buy a gun, to have manufacturers have to be responsible if they act irresponsibly. These are 3 measures I think are common sense. I think that they can help us reduce the gun violence we've seen. But there is kind of the largest effort I think the legislature needs to take this year is in our homelessness crisis. Now, this affects every community, including the Latinx community. And we know that a lot of our homeless people have chemical dependency issues. We know a lot have mental health issues, but you can't help them solve those problems unless they have a home to live in. So I've asked the legislature to step up to the plate and do a large expansion of our housing to have more homes for people to live in. We don't have enough homes for people to live in. And we've had about 1 million people move in the last several years, but we've only built about 350,000 housing units. Well, you know who ends up homeless are those on the lower end of the income scale, including a lot of hardworking Latinx folks. So I have asked the legislature to adopt a program to invest another $4 billion to help build low income, to help get support services, to make sure that we can reduce this scourge of homelessness in our state. And I hope this community can help lead on this. I think it's very, very important. And it's going to get worse if we don't act. And the reason it's going to get worse is we have so many people moving to our state. We're bringing people from all over the country and the world, all kinds of folks, computer scientists, biologists, agricultural workers, everybody, because it's a great place to live. But if people don't have housing, we're going to have a continued homelessness problem. Now, obviously, we need better chemical addiction programs. We need better mental health programs. That is also in our proposal. So I hope during your discussions with legislators, you can talk to them about the importance of housing, and you can talk to them, urging them to be assertive and bold when it comes to housing. You know, my view is this year in the legislature, we need to go big so people can go home. And I think that's the issue that I hope will be one of the biggest successes this year in the legislature. So that's a quick report from the governor's office. And I want to thank you for being here, even remotely, talking to your legislators. I cannot overstate, you know, you take your time. I know you're busy, you got family, work, but that you will take your time to talk to legislators. I really appreciate, because you really bring a sense of reality to when you talk to legislators. And I can tell you that I know it takes a lot of time and effort, but it can really make a difference. When you tell a person why you think these are important, and you tell them your personal story or family's story, it can touch people. So I really want to thank you for what you're doing.
Thank you, Governor. And I wanted just to share, just as a comment, that small businesses, we need your help. We need state legislature help. You know, we play a huge role economically in the state of Washington, and definitely during the pandemic and after, we need access to capital and operating funds. And so I know you've been a champion for small business. We've had a few meetings with you, but just to remember that as you're talking to legislature and any policies, right now we're doing a lot of advocacy in Olympia right now for this. It's one of our top priorities.
Well, I'm very appreciative of you doing this, because we know it's the heartbeat. It's the largest job creation engine in small businesses. And so I'm glad we could work together during COVID. Let me, if I can, just give you a couple ideas of things I would like to do in this. One, we want to make sure small business have personnel to work in the small businesses. Finding staffing in a lot of small businesses has been a real challenge for businesses, large and small. And I'm very excited about our efforts to produce more people who can do this work, who have adequate skills. And I know we've worked together on the Career Connect learning program. So we have more apprenticeships, and we can get people into construction trades and agriculture work and healthcare. We've also increased our access to colleges. We do have, I think, the best financial aid package in the United States. So we can get people to actually do the work in these small businesses. I think that's one of the most important ways the state can help small businesses. I met with the small business community in Pullman, Washington, a couple of days ago. And one of the things that they urge us, and I really agree on, is our Main Street program that helps usually smaller communities sort of enliven their downtown cores to get, better sidewalks, public events, festivals and the like, to bring more people in. We have a lot of these small businesses on Main Street. I love that Main Street program. We're gonna try to make sure that we support it. Now, those are small bits of capital, but those small things, when you pool those resources to spruce up your town, that can really help small businesses. I think we're always looking for capital, as you know. So we're going to have some capital available, in our clean energy bill. So we have about $360 billion of federal money, and we're going to have several $1 million of our clean energy fund that can help companies that want to help. We have an emerging supply chain. When I was in Pullman the other day, I saw this company that wants to do a biofuels refinery to make biofuels, which is really good to fight climate change. There's a lot of small businesses that will be able to feed that mill, trucking companies, small trucking owners, people in the ag industry growing the crop, the canola, insurance companies selling insurance to those companies. You know, that seeds a bunch of small companies. So any other ideas you got, please let me know.
Thank you. Well, Governor, thank you again for your leadership. So glad you joined us. Thank you.
Thank you. Keep
All right.
talking.
Likewise. Our next is our special, our second 2023 Latino Civic Awards awardee recipient. We are honoring Padres Tomando Acción. They are from Quincy, Washington. Do we see them? Oh, there they are. Hi, Aurora. How are you?
Pretty good. How about you?
Good, good, good. Where's the team? All right. Okay, so everyone, I just want to recognize these amazing leaders. This grassroots organization is based out of Quincy, and they are receiving the 2023 Washington State Latino Legislative Award, and for their significant contribution, their leadership and grassroots advocacy for Quincy School District parents to have access and their children to receive educational excellence in recognition to serve others that is substantial in perseverance, integrity, heroic, and time commitment. I want to just share, Aurora, to everyone there, to your organization. This is a small grassroots that you have done some amazing work within the year. I don't know if you really understand the impact, but it's been tremendous. I see that Representative Alex Ibarra here is also is witnessing this award, and but being that you're based out of Quincy, you make us proud. And I just want to say thank you so much for doing all the work that you have done to make differences in the school district and advocating for parents. It means a lot. We need it in Quincy and the surrounding areas in Grant County, and you are that strong voice. So thank you. And so on behalf of our organization, we're not there in person, but there in spirit is the award we're extending to you. So please, this is open for some remarks.
So thank you and good afternoon, guys. Can you hear me?
Yes, we can hear you.
Oh, okay.
Doing great.
First, we would like to thank Latino Civic Alliance and Nina Martinez for hosting us today on such an important day. Who would have thought that a stay-at-home mom and grandmother and a lot of mothers and fathers, all Latinos from Quincy, Washington, would be receiving this award. We are very, very and truly humbled. It is important to us that I also introduce myself. I'm Luisa Cervantes, and this is my co-founder, Aurora Vasquez. We also have Lupe Hernandez, Alan Cortez, and other key leaders of our board, Dalia Ramirez, Cynthia Garcia, and Priscilla Tovar, who were instrumental in helping us get started. We also want to recognize our partners and children, because it is because of our children that we began Padres Tomando Acción.
Also, thank you guys so much for this great opportunity. Today, we would like to inform you guys a little bit about what our group represents. We represent many parents in Quincy and surrounding areas, mainly Spanish-speaking parents. Our goals are to help parents, students, and district staff create a climate where our children become lifelong learners, our district and parents have excellent communication, and that safety is valued and practiced for all our students. We want to be that bridge for all parents who need assistance to ensure their children's rights in their education. Also, we respectfully and humbly accept this award that was given to us for all the parents, students, and school staff in our school district and others in North Central Washington who want to see more partnership. We want to see more partnership with parents, school district to improve the lives of our children. Again, thank you guys so much for the award that we received. If it's okay with you guys, I would like to say something in Spanish as well.
Yes, of course.
Okay. También queremos darle las gracias a los padres, a sus hijos y a nuestra comunidad aquí de Quincy, al distrito escolar. Muchas gracias porque por este El premio que recibimos por Latino Civic Alliance fue por ustedes. Sin ustedes esto no fuera sido posible. Muchas gracias por siempre estar con nosotros y por habernos ayudado a llegar tan lejos como estamos ahorita. Esperamos que sigan a nuestro lado para poder seguir siendo los cambios que estamos haciendo. Muchas gracias.
Gracias. Thank you.
Well, thank you again, everyone. Alvaro, thank you so much for your advocacy. We honor you today. Thank you. Thank you so much.
Thank you.
So now we will move. I just noticed our keynote speaker, Senator Valdez, was able to join us. I know there was some technical complications. So Senator, we could go ahead as your keynote, have you speak first, and then we'll have our other members of caucus, Latino caucus speak. Floor is yours. Congratulations.
Hi, Nina, and thank you, everyone. Happy Legislative Advocacy Day here for Latino Legislative Day. It's great to be here. Buenas tardes. I am Javier Valdez, State Senator representing the 46th Legislative District here in Washington State. And again, thank you for the invitation to speak to you all today. A little about myself. I'm a proud first generation Mexican-American, born and raised in rural Eastern Washington, Moses Lake, and came to Seattle quite a while ago to come to the University of Washington, and I've been here ever since. I think some of you know about my personal background story, which I always talk about, and I'm the proud son and grandson of farm workers and laborers. And like many of you here today, both my parents had limited education, but like again, many of you, my parents raised me and my siblings to work hard, to be dedicated. Obviously, to go to school as best as we could, and family is everything. And those are the values that they instilled in me. And those are the same values that many of us present today, who are here today as well. And we are here today to acknowledge the importance of hardworking Latinos in our state, to remember that our contributions to our communities are very, very important. With over 1 million Latinos in our state contributing to our economy's growth, it would be remiss to ignore the importance of our community again right here in Washington State. Latinos are a large part of our state's workforce, as we are involved, of course, in many important industries, whether it's agriculture, forestry, construction, the hospitality arena, where our community and our folks work long, hard hours, to meet the needs to support their families. But our community, as time and time again, has shown resiliency and resolve, especially during the pandemic. And we've helped carry Washington's economy throughout some of these tough times over the last several years. Arguably, we're undeniably indispensable in our state. We cannot ignore the fact that we are disproportionately affected by the lack of opportunities and lack of equal access to healthcare, education, and other fundamental rights. Did you know that out of every 100 Latino students here in the state of Washington, only 64 will graduate from high school? And only 15 of those 100 will obtain a bachelor's degree, and only 4 will graduate with a professional degree. Still have so much more work to do. Additionally, only 82% of Latinos in Washington have health insurance, compared to 95% of the white non-Hispanic population. And I think all of us here who are here present today know that that simply is not enough. We're not doing our job, and we know that every Washington should have a right to health care. It's a fundamental right. But those statistics clearly show, again, that we have so much more work to do for our communities. And it's imperative that our voices are heard, and our needs and rights are a topic of discussion and a priority right here in our state legislature. And one of the most effective ways that we as Latinos can make a difference and make our voices heard is by getting involved and voting. By voting, we can hold elected officials accountable for the decisions that we as lawmakers are making on our community's behalf. Latinos are the fastest growing demographic in our state, And with that growth comes the power to impact decisions that are being made at all levels of government, whether it's here in Olympia or at their own local level. It's crucial that we become informed voters so that we can choose the best candidates with our shared values to represent our communities. We need to read up on issues that are important to us and support legislation that supports us. And this includes ensuring that hardworking and underappreciated farm workers in Washington are paid for the vital work that they do and protecting their right to receive overtime pay, just like any other worker in our state. It's our moral obligation to do this. We must also fight so that our community in Washington have equitable access to financial support programs, regardless of their immigration status. Latinos who lose their job deserve the same assistance as any other Washingtonian to help them survive and meet their basic needs while they are unable to find employment. These and other critical issues deserve our attention and involvement. If we vote and fight for the change and fight for the things that we believe in, with our numbers, we can affect real change. I want to take this opportunity today to encourage each and every one of you to talk to your legislators. Talk to us about your concerns. Tell us what your needs and priorities are. And it's so important for us to hear directly from you what your concerns are and what you expect from us. Make it very, very clear to your government officials and your elected officials that you are involved and you care, and that what they do has an impact on our communities. Pay attention to their actions and make sure that they are actually advocating for our community and committing to what they have promised. It is us to hold them accountable and to make sure that they listen. Remember, our collective power lies in our ability to make our voices heard. Find what you're truly passionate about and pursue it. Latinos can and will make a difference if we put our minds to it and help each other together as a community. I want to thank the Latino Civic Alliance for putting together this annual event that inspires so many of us throughout the state to come together as a community and empowers us to speak and to fight for what is right. To fight for what we deserve, and that is, being treated with respect, equality, and dignity, and to remind us that we are very important here, the Latino community, and whether that applies to whether you're from rural or eastern Washington, central Washington, southwest Washington, or even the fields up in Waukesha, Skagit County. We are capable and we can make a difference. Sí se puede. Thank you for having me here today.
Thank you, Senator Valdez, for your leadership. Thank you so much for participating and as being our keynote. Our next speaker will be Representative Cortez. Are you? Oh, there
Great.
you are.
Yeah. Hey, thank you so much, Nina. And hey, thank you all. I'm sorry I couldn't be here this morning, but I hope you guys all got my video with a little bit of information. Really quickly about myself, Julio Cortez, I'm the state rep up in the 38th Legislative District. I was born in Mexico City. My mom's from Guadalajara, my dad's from Morelos, and we immigrated to the US when I was about 5 years old. Took me a while to learn English, but hey, I think I'm doing pretty well here today. I grew up in Wabato, Washington, very small immigrant farm working community. It was a great place to grow up. It was very diverse. And thanks to my parents who worked incredibly long hours, like I'm sure a lot of our parents here in the fields, I was able to go to college and started my professional career in 2009, right after college, with a nonprofit that serves at-risk and homeless youth in Snohomish County. For me as a new legislator, I'm incredibly first thankful to, the great leaders that you all see on screen here today. They've been great mentors and leaders for me personally. Two of the big things that I really want to focus on as a legislator is one, the root causes of homelessness. A lot of our communities, specifically the Latino community, has always been very strong in the family unit. And as hard as we work, there's always issues with making sure that we have roofs over our head and food on the tables. And so I want to make sure that we as legislators support our middle and low income Latino families who are a paycheck or two away from losing their home or a medical emergency away from losing their home by supporting them as their elected officials. Number two, and I know we only have 2 minutes, so I'm trying to go fast here, but economic equity is another big one. During the pandemic, in my other role at the city of Everett, I'm a small and medium business liaison, and what I found is during the pandemic, there was all this money, all this support that was available to small and medium businesses, and our Latino business owners weren't getting the information at all, or were getting it too late. So I think we need to do a better job of ensuring that our communities, specifically our business communities of Latino ownership, have the information they need to be successful. So I hope that we can do this. I'm very, very excited and honored and proud to be part of the Latino caucus that is being brought up here this year. I look forward to working with everybody. Stay connected, bug us. It's, we got to continue to say si se puede, but we got to start saying si se pudo. So let's keep it going. Thanks, everybody.
Thank you, Representative Cortez. Our next speaker will be Representative Ramos. Welcome.
Thank you. And thank you all for being here. Thank you for the work you do. That's what keeps things going in our community, in our neighborhoods, and keeping us informed on the best way we can approach you. Again, I'm State Representative Bill Ramos from the 5th District, which is the eastern part of King County, from Issaquah towards Snoqualmie Pass. And so we have a mix of areas here, and trying to work with us as Latinos. I'm very proud of the fact that this year we do have a Latino Democratic Caucus. We officially just formed this a few weeks ago, and that is going to give so much power to our voice as a whole. There are 11 of us, 3 in the Senate, 8 in the House, and many of you are seeing here on the screen. And the fact that we can get together strictly to work for Latino issues, where before we worked for issues for all people of color as a group, now we can really focus on those things. So finding out what those are, because at different parts of the state, some of those things are more important than others, but all across the things that cut for all of us for equal opportunity, access is really what is needed. So we will continue to speak out, as others before me have said. You reach out to us. If your representative for your district you don't feel represents you very well, please reach out to one of us you thinks represents you better. I've done that before when I had representatives and senators that didn't truly represent my wants and desires. Reach out to someone else who may hear you better. Don't be shy on that. And so continue to do that. We're going to continue working on all these things, like I say, access for opportunities for better healthcare, education, work, you name it. That's what we're trying to do, is just give more access and opportunity to everybody. We know when we have access and opportunity, we will be successful. There's no doubt there. We will always work hard and do that. So with that, I know we're just quick and we're running behind time. Again, thank you. Reach out to me anytime, no matter where you live in the state, if you feel comfortable with that. And know that I'm the vice chair of our Latino Democratic Caucus. So we are working to make sure our priorities as a Latino caucus are heard with a lot of power now, more so than before. So thank you very much.
Thank you, Representative Ramos. And I want to tell, we spoke earlier today about the first Latino caucus and how proud and how exciting this is for us. So thank you for your leadership. We know you're the vice chair, but to all of you, thank you so much for forming that. Thank you. So our next speaker is Representative Alex Ibarra. Welcome. He represents Moses Lake area. You're on mute. There you go.
Okay. Am I good now?
Yes, you're good.
Okay, great. So my name is Alex Ibarra. I'm from Quincy, Washington, and I represent the 13th District, Central Washington. So Kittitas County, North Yakima County, all the way out to the White Pass and down to Moxie. Also most of Grant County, Moses Lake, Quincy, Freda, Soap Lake, just about all the way down to Othello. So that's where I grew up in Quincy, was born and raised. My mom and dad were migrant workers back in the day, and I think you might have heard from my sister Mary Jo. She was, I think she was one of the speakers heard here this morning. And so she and I came from the same family, and I think I was supposed to talk about education, so maybe I would talk about that a little bit. So I was 9 years as a school board member on the Quincy School Board. Actually, I'm one of the 2 other folks that put together the bond to build the new beautiful Quincy High School. So very happy and proud to hear the selection of the Quincy folks for that award. That was very nice of you to do, Nina, and your group. So thank you very much for that. Again, came to the legislature, was in the K-12 education committee for the last 4 years. This year I jumped over to post-secondary. So now I deal with the colleges and stuff. So any education question you guys have, please send it my way. Again, Nikki Torres, Senator Torres and I are the only Latino legislators that actually represent folks in Eastern Washington. She's in the 15th and I'm in the 13th. And so if you guys have any questions or anything, just let us know about anything you would want to know about. But we're all, sounds like we all came from similar backgrounds, mostly from Eastern Washington, mostly farm workers. And I'm very proud to work with Senator Saldana, Senator Javier, and the rest of the legislators that are here because they're great to work with. I'm really proud to work with those folks. And again, if you have any questions, let me know.
Thank you, Representative Ibarra. Thank you for joining us. Thank you so much. Our next speaker, we have two more. I see that Senator Saldana joined us in person. So we will have her speak to everyone, and then we'll close with Representative Mena. Hello, Senator.
Hello,
Welcome.
thank you so much. Great to see you, Nina. And it was great to have people visit us in real life and also to see so many people participating virtually as well. We in the state legislature and the Senate want to make sure that people have access to your state government, whether you're at home or whether you are able to travel to Olympia. And have to do a shout out in particular to the interpreters that are on the call today, making sure that whether we're speaking in English or Spanish or Spanglish, that we're all able to understand one another. And have to say that we had a great hearing today in Senate Bill 5304, which is about making sure that we provide quality, professional, accessible interpretation, medical interpretation to and access to services for everyone wherever you live. And so I'm hoping that we will be able to keep that bill moving forward and recognize that the interpreters that are organizing to make sure that people have access to quality interpretation. So thank you. And a similar, even though I live in South Seattle, when I came to the legislature, we opened our doors to every Latino, no matter where you live, and tried to make sure that as part of the majority caucus and the majority vice chair of our caucus is to make sure that we're seen and that we are connecting to create policy that works for Latinos. So I will be in Yakima in June. I would love to be invited to meet with young people and our elders and making sure that we are creating amazing opportunities for Latino businesses, whether that's in agriculture or hospitality or technology, but making sure that we're also creating quality jobs for everyone, whether they're picking asparagus or whether they are taking care of our children in our homes. And so look forward to working with you and so thankful for your engagement and your advocacy.
Thank you, Senator Saldana. Thank you again for all your support and leadership. Thank you. Our last legislator will be Representative, my understanding is Mena, and then we will move to our policy sessions right after.
Hi, everybody. I'm really excited to celebrate Latino Legislative Lobby Day, this time as a first-year member of the House of Representatives. As some of you may know, I used to be a staff on the Senate side and loved celebrating Latino Lobby Day, especially when we had Mariachi Wenatchee here in the Capitol Dome. So today, I just want to talk to you briefly about some of the bills that I'm supporting this year. I'm proud to sponsor the Washington Voting Rights Act 2.0, which, as you know, is a really important bill in making sure that communities across the state of Washington have the opportunity to access the Voting Rights Act, to make sure that our votes matter, and to make sure that we have great representation across the state. We've seen successes with the WVRA and Wenatchee, and we want to make sure that those successes can be replicated across the state. Another good bill I'm supporting is the utility shutoff moratorium during extreme heat. This will make sure that people can keep their water and electric on when we have those really, really hot days. That's important on the west side as well as the east side, and I hope you guys will join me in supporting this bill. I just want to thank you for your advocacy. Thank you for being here. Thank you for all the work that you do. When we do it together, we can get a lot done. So I appreciate you. I'm really excited to meet some of you in my office for a meeting I just want to thank you for all that you do, and happy Lobby Day.
All right, everyone. This concludes our legislators speaking and our special program. We will now move to our policy sessions, and my colleague Claudia Delegre will facilitate the next panel discussion.
Thank you, Nina. Claudia de Alegre, Chair, for one of the board members for Latino Civic Alliance. Just wanted to tell you, give you a little input. We are here in Olympia, so I hope you don't get a lot of feedback. We have a delegation of 14 people. We had several meetings today. Meetings have been going really well. We get a good reception, so a lot of good things happen. Thank you, Nina. Latino Legislative Day so far has been a total success. Had the pleasure to introduce our next panelist, who is going to be talking about the dangers and opiate fentanyl epidemic impacting children. I had the pleasure to introduce Dr. Alexis Wall. She is a primary pediatrician and also worked with the child health equity at the Seattle Children's Hospital. Dr. Wall is of Venezuelan descent and a passionate for providing services and improving the health of the Latinx community. Please help me to welcome Dr. Wall. Thank you. Thank you for being here today.
Hi, everyone. Thanks so much for inviting me. I'm really excited to talk with you all today. I'm sharing my PowerPoint now. Is everybody able to see it?
Yes, looks great.
Yes.
Yeah, so hi everyone. My name is Alexis Ball, and today I'll be speaking to you on the opioid epidemic in youth around the dangers of fentanyl. So before I begin, I think it's important to note how I arrived to this space, who I am, and why this topic is so important to me. So first and foremost, I'm a daughter, a sister, a tia, and a prima. I hail from a long line of strong Latina women who have taught me the power of community and family and its role in well-being and resilience. I also love people who use drugs and have family members affected by addiction and substance use. Through these relationships, I've experienced the impact of substance use and addiction on families. I've also seen the poor care individuals with addiction can receive and disparities in care within my own family based on one's identity and background. I'm also a general pediatrician and a child health equity researcher. My research is focused on addiction and substance use in pediatrics. And my goal is to leave substance-related cares, particularly among minoritized communities. And although I will be talking about the opioid epidemic in youth today, I think it is important to highlight that substance use and addiction impacts pediatrics in numerous ways, whether it is youth substance use or addiction, prenatal substance exposures, or caregivers with addiction. Substance use and addiction are fundamentally a pediatric problem. And before we talk more about fentanyl, I want to briefly review what opioids are. Essentially, they're a group of substances that interact with the mu opioid receptors in the brain that when taken can result in pain relief or euphoria, or if taken in greater amounts can result in stalled breathing, decreased heart rate, which ultimately can result in death. Opioids come from the poppy plant or can be synthesized in laboratories. Common opioids are oxycodone, hydrocodone, morphine, heroin, and fentanyl. And today I will be talking mostly about illicit fentanyl. And I want to emphasize that in healthcare settings, we do use fentanyl for anesthesia and rapid pain control. So if you hear fentanyl while in a medical setting, you shouldn't necessarily be alarmed. As many are familiar, we have been experiencing an opioid epidemic over the past 20 years. And for more than a decade, drug overdose deaths have been the leading cause of injury death in the US among young adults. This epidemic has had 3 waves, the first of which starting with prescription pills such as oxycodone in the early 2000s. And then wave 2 began in 2010 as we started improving our prescribing practices, but then we began to see a rise in heroin overdoses. And finally, around 2013, we entered in the 3rd wave, which we're currently in today, with a rise of deaths in synthetic opioids such as fentanyl. In Washington and the West Coast in general, we really started experiencing the impact of wave 3 over the past 5 years or so. Fentanyl is now the leading cause of overdose deaths among young adults. And 2021 was the deadliest year of the opioid epidemic thus far, with over 100,000 overdose deaths. And this unprecedented increase in overdose deaths has been fueled by the continued proliferation of highly lethal and potent synthetic opioids, such as illicitly manufactured fentanyl and fentanyl analogs. Fentanyl is 50 times stronger than heroin and 100 times stronger than morphine. It has a very rapid and short effect. Experts consider 2 milligrams of fentanyl to be lethal, and this amount is incredibly small. Next to the penny, you can see what 2 milligrams of fentanyl looks like. And most illicit fentanyl in Washington state is in the tablet form, made to look like a legal prescription opioid pill, as seen in the photo on the right. Many of these counterfeit opioid pills contain up to 5 milligrams, more than twice the lethal dose of fentanyl. And fentanyl is widely available and inexpensive. In 2021, powdered fentanyl has become more common and is in the local drug supply. And then fentanyl is also contaminating other substances that are either produced in the same place or intentionally part of the product, such as Xanax, stimulants, or ecstasy, to name a few. So far, many individuals may be thinking that they're taking something such as a Xanax to help with anxiety or Adderall to study, and it really is a fake pill that is contaminated with fentanyl. And this changing drug landscape and the impact of the opioid epidemics affects all US demographics, but has been hitting adolescents particularly hard over the past several years with the emergence of fentanyl. From 2019 to 2021, median monthly overdose deaths among adolescents increased by over 100%. And you can see this denoted on the graph by the gray line. Prescription type opioid use is still widespread among adolescents and often the introduction point for adolescent opioid use. However, the recent surge in opioid deaths appears to be driven by illicit opioids such as non-prescription fentanyl. And given that fake pills look identical to real prescription pills, it is no surprise that this is happening. In fact, in 2021, while among the general population, 73% of overdose deaths involve fentanyl, whereas among adolescents, a higher percentage at 84% involved illicit fentanyl. However, from the overdose data, we are unable to tell if the overdoses were secondary to intentional use of fentanyl or not. And the recent and dramatic increases in fentanyl make for a particularly dangerous situation in adolescence. As shown here, the adolescent brain is maturing. Areas that are less developed are shown in yellow or green, and areas that are more developed are shown in blue. Brain development during adolescence makes youth particularly vulnerable to initiating substance use, the effects of substance use, and to develop substance use disorders or addictions. Essentially, the adolescent brain is all gas and no brakes or very weak brakes. This is particularly scary with fentanyl as by the nature of this development, adolescents also tend to carry beliefs about their own invincibility. Studies have shown that younger people seem to perceive more immunity to fentanyl's lethality and underestimation of the risks of addiction. Adolescents and young adults may believe that they cannot overdose or become addicted to fentanyl because they are healthy, using a pill that does not look illegal and they are not injecting it. And then another important distinction in all of this is that substance use occurs on a spectrum and that not all use is addiction, but can result in substance-related harms, such as overdosing. Addiction is a complex disease that results in continued use of the substance despite harms. So an adolescent may be using drugs casually and not have an addiction. However, they also may not fully grasp the risk of the current drug landscape with fentanyl. By the nature of their age, adolescents have a shorter drug use histories and therefore less experience using and being around people who use. They may think that they are just partying or engaging in drug experimentation, but because fentanyl is so potent and contaminating so many substances, it poses risks for quickly developing physical dependence, a use disorder, or death by opioid poisoning. And really, any use can be risky use in the world of fentanyl. Moreover, anecdotally, we're seeing a rapid onset addiction secondary to fentanyl. Whereas before, it might take half a year for an individual to develop an addiction. We're seeing in adolescents in particular that addictions to fentanyl are occurring within several months. Essentially, being an adolescent in general already shifts our paradigm of risk greater. And again, the emergence of fentanyl has only worsened that. And importantly, as overdose deaths have increased, the demographic profile of those dying has shifted and now is disproportionately affecting certain racial and ethnic minoritized populations. Notably for youth, overdose mortality rate is highest among indigenous and native adolescents. However, if you look at the line in yellow, starting in 2019, Latina youth experienced the second highest overdose mortality rate, a trend that has not been seen amongst adults. And so something unique is happening in our communities right now. And unfortunately, along with increasing overdose mortality, minoritized youth are also less likely to be identified as having substance use disorders or addictions, report lower quality and less intensity of care, have lack of efficacious and culturally relevant treatment, and are disproportionately targeted, arrested, and incarcerated in relation to non-medical drug use. Much of these inequities are born out of the war on drugs, which has fostered a condescending moralism that conflates drug use with violence or bad character, and costs drug users as criminals who deserve punishment, furthered by drug laws and enforcement that has reflected explicit racism. And this does not even touch upon the impact of the war on drugs, which it has had on our communities' home countries, leading to so much violence and displacement of people. So given all this, what do we do? I think first and foremost, we need to keep people alive, and overdoses can turn deadly within minutes of taking drugs laced with fentanyl. So being able to act quickly might just save a life. And this is pivotal among helping young people, as potential bystanders were present during 2/3 of overdose deaths among adolescents, the majority of which occurred at home, where bystanders were often family or friends. One of the primary ways of stopping an overdose is with Narcan or naloxone. Narcan is an opioid reversal agent that works by essentially blocking the effects of opioids on the brain and restores breathing. Narcan is an incredibly safe medication and really does not cause any harm if given to someone who has not used opioids. So it is really important for us right now to both recognize the signs of an overdose, primarily being somebody being unresponsive, having a slow, irregular breathing pattern, discolored skin, small pupils, and then being prepared to give Narcan. In Washington State, there is a standing prescription for Narcan, so anyone can go to a pharmacy and pick it up without a dedicated prescription. There are also resources in King County in particular, which is where I reside, that will mail you a Narcan for free. I personally carry Narcan in my car and on my person whenever I go out. There's also a Good Samaritan law that protects someone when calling 911 to save a life if drugs are at the scene. And while fentanyl is extremely potent, you cannot overdose by simply touching it or by performing CPR on someone who has overdosed. Educating family and friends to recognize the warning signs of drug use, effectively responding to overdose, and monitoring adolescents exhibiting risk behaviors associated with drug use might improve bystander response and prevent deaths. And it's a really good first place to start. And part of preventing overdose deaths also comes with preventing or delaying substance use. And while teens are developmentally naturally looking for independence, they still seek parents as guidance. Teens say that when it comes to substances, their parents are their most important influence. That's why it's important to talk and listen to your teen about substances. And essentially, this really requires an ongoing conversation. Just saying don't do drugs simply doesn't work. Find a real time to connect with them and talk in an honest and open way. Avoid lectures. Ask your team what they have seen or heard about drugs or substances. Recognize that social media, TV, movies, and songs can glamorize or trivialize drug use. So engage. What are they listening to? What have they seen? What is their understanding of the current environment? And listen to your team's opinions and questions about drugs. Discuss the reasons not to use drugs. Emphasize how drug use can affect things that are really important to your teen: sports, health, relationship, academics. And while it is important to not employ scare tactics, educate them about the real risks of fentanyl. And then, super importantly, be clear about your expectations around drug use and discuss ways to avoid peer pressure around use. What you say matters, and what your expectations are really does matter with youth. Other preventative strategies: engage with your teen's life, know your teen's activities and friend groups, pay attention to what your teen likes. What are they listening to? What are they watching? Again, this will help you understand maybe TV shows or music that are glamorizing substance use or drugs. Understand where your teens are hanging out, who their friends are, and then be mindful of social media and the influences on it. Social media right now is actually a very common place that youth will be able to actually purchase drugs and substances. So it's important to know how they're currently engaging with their social media platforms, whether it be Snapchat, Instagram, TikTok. Understand what they're doing and what type of things they're seeing on that. It's also really important to establish rules and consequences. Explain your family rules, such as the expectation of not using drugs or alcohol. And if your teen breaks the rules, consistently enforce the consequences. Again, those set expectations and those rules are really important so teens and youth understand what's expected of them. And then, super importantly, provide support. Offer praise and encouragement when your teen succeeds. The strong bond between you and your youth might help prevent your teen from starting using drugs or come to you if something does come up. And then, importantly, set a good example. Evaluate your relationship with substances. Research has shown that if parents or siblings frequently use drugs or substances, alcohol, cannabis, teens are more likely to engage with it and at earlier ages. So that puts them at higher risks of substance-related harms and addictions. And if you drink, do so in moderation and model good behavior. Make sure that you're not driving after you have been drinking. And honestly, be ready to have conversations around your substance use with your teen, because questions are going to come up. What have your experiences been? What is the relationship with substances in your family? What is the relationship of substances in your cultural history? What does it mean for you to be thinking about drugs in your family? And even if you do everything right, your teenager or youth may still engage with substance use. So identifying it is very important. Among adolescents who have overdosed, nearly all deaths have involved opioids, largely fentanyl, but only a third of youth have documented opioid use history, which suggests that recent initiation of substances or using substances that have been contaminated with fentanyl, or that there is a lack of awareness of substance use by family or friends. So what are you looking for? You want to look for signs of sudden or extreme changes in friends, eating habits, sleeping habits, appearance, and performance, a sudden increase of breaking rules or withdrawing. These are things that may be a sign of drug use or honestly deteriorating mental health, or both. We do know that mental health conditions are extremely common and are also a known risk factor for substance use. So speak with your youth or your teenager about these changes in an open and non-judgmental way, and link in with your pediatrician about any concerns that you might be seeing. You can also talk with your pediatrician about how to have these conversations about substances or drugs, or starting these conversations. Use us as a resource. We want to be here to be able to help you. Also, be on the lookout for signs of drug paraphernalia or common like terms or emojis for drugs that will also kind of give you some insights into whether your teen might be engaging in substances. And if you do find your teen is using drugs, it is important, again, to have a conversation about use. Explain the reality and be clear about the risk. Again, just telling your teen not to do drugs, frankly, is probably not going to be helpful and needs to have a bigger conversation. You need to review that fentanyl is something that is out there. Make sure that they understand that they know what it is, that it's tasteless, odorless, and too small to be seen. Fentanyl overdoses do not just occur from people who get drugs from random people. There is no safe source to get substances. Substances are laced with fentanyl long before they reach friends, dealers, or that trusted friend of friend. And it is imperative to employ harm reduction if your kid is using substances. Ensuring that your house has Narcan, that everyone knows how to use Narcan, emphasizing to the teen that they should never use alone. Narcan doesn't work if you have it in the room and you're by yourself. And also consider having test strips. Test strips are available to test drugs for the presence of fentanyl. Unfortunately, how fentanyl can be distributed in a substance means that a negative test does not mean that there's no fentanyl, but a positive test means that there definitely is. And so this can help you understand kind of whether the substance that you're using is safe. These things are really important in keeping youth alive in order to get them to the point where they can receive help or treatment, and importantly, to live out their goals and dreams. And you can do a harm reduction approach while still providing consistent messaging that no substance use is the best course of action. And then if your child does develop an opioid use disorder or an opioid addiction, so using opioids despite harms, it is important to know that there is treatment, especially one of the best treatments that we have is a medicine called buprenorphine. It also goes by Suboxone or Subutex, might be other names that you've heard. Buprenorphine is a medicine that is FDA approved in adolescents to treat opioid use disorder or opioid addiction. This medicine manages cravings and withdrawal symptoms. It reduces illicit opioid use and decreases the risk of having an overdose. Buprenorphine lowers the risk of death by 50%. So it's really a life-saving medicine that treats opioid addiction. And yet, anecdotally, what we're seeing in Washington is many Latina youth with opioid use disorder are not wanting to take buprenorphine, even though it is a life-saving medication. And so we need to really understand what's kind of causing these trends. So that brings me back to thinking about substance-related inequities. The past slides, I have discussed ways to reduce drug use, overdoses, and increase identification, of which hopefully will decrease some of the disparities that we are seeing amongst our community's youth. However, more work is needed to address the substance-related inequities faced by our community. We need to better understand the drivers of high overdose mortality rate among Latina youth. Are there specific pressures of acculturation? Are youth experiencing discrimination, stigma regarding substance use, riskier drug supply facing our youth, or something else entirely? We also need to understand why there's such a reticence in engaging in treatment, a life-saving treatment. We need to further interrogate the impact of drug policies on Latinx communities to ensure we do not continue to perpetuate or reinvent the war on drugs. And most importantly, we need policy that supports and uplifts our communities. A quote that guides me in my thinking of much of the work that I do is responsible drug policy is about more than drugs. It is about the flourishing of entire communities. And so what policies can we adopt or think about in order to support communities in order to prevent substance use? I think that that's the goal of where we need to go. But at this exact moment, we also need to make sure that we're keeping our youth and community alive. So how do we prevent this current crisis and also work on supporting the communities that we have? And with that, I will take any questions.
Thank you. Thank you, Dr. Bald. Yes, we have some questions that have come up in the chat, so I will ask you a few of those. One of the question is, would you say that might be risk for people during surgery that might lead to become addictive?
Sorry, what was the first part of that question?
So would you say that there might be a risk for people during surgery who have received fentanyl that could become at risk to be addictive?
Yeah, so the use of fentanyl in like anesthesia, it's something that is used at a small dose in order to kind of like induce anesthesia. And so that's not something that I'd be worried about in regards to risk of addiction. It's not something that a medicine that is sent home with you. It really is because it's a short acting medicine that is really good in helping people undergo anesthesia. And so I wouldn't be fearful of fentanyl in anesthesia settings because it is a very good medicine. And so again, it's just important that that's not the type of fentanyl that we're seeing right now. We're seeing illicit fentanyl out in the community.
So maybe following that, there is another question asking, how come it's so common right now that it became to be a drug that's very prevalent in the community? So there's a question of what happened.
Yeah, so I think that there's been a lot of theories about exactly what has led to this point today. One of which is that as we've continued to try to prevent substance use and a lot of the prohibited drug policy, more or less that has led to an evolution to more potent and smaller substances in order to kind of evade regulation, evade being caught. And so that has entered into the drug supply. And with that, fentanyl is super potent, and that leads to both addiction and this risk of overdose. So it's a product that is unfortunately very successful because it causes, again, those high euphorias and that risk of addiction.
Yeah, one of the things that we see in the treatment centers we run at CMAR, we run treatment centers what is specific for youth, residential for substance abuse. We definitely see a great amount of kids who are coming who are using fentanyl, but we also seen that the families do not know, especially Latino families do not have much information about this. So are you aware of efforts in terms of educating the Latino population? Is there presentations in Spanish that can be distributed? Any efforts to educate the Latino population?
Yeah, so I mean, I think that hopefully conversations like today are a starting point for these conversations. I know that the Latino Civic Alliance is doing a lot of work on trying to start these conversations. And I think honestly, there's not enough, there hasn't been enough on a state level of facilitating more of these conversations. And so I hope that today is a starting point that we can continue kind of this education and awareness around the risk of fentanyl.
Yeah, we had several questions that keep coming, but I know we don't have a lot of time. So I just kind of look a couple of the questions that are here. Some of the question is, why do we allow labs to continue producing Oxycontin or continue being in the market producing these drugs if we know they are so addictive? Why it is no efforts directly to stop the labs who are producing it?
Yeah, so there's the medical, again, like use of these substances, which they do have, I think, like, unfortunately, like they're good medicines in controlling pain, and they do come with this risk of like addiction. There's also good medicine, like I said, for induction of anesthesia. And so I think, unfortunately, given our history of over prescribing opioids, and we are now at the point that we have this medicine that when we use it appropriately and understand the risks of somebody who is using it, that it is like a good medicine. But outside of that, we have kind of now this explosion of use and illicit manufactured fentanyl. And so even if we were to completely get rid of, let's say, any medical use of opioids, we would still have this illicit manufacturing of fentanyls, and that's again kind of currently what's in the community. And so unfortunately, I don't think that just getting rid of the production of it will kind of solve the problem that we're currently at.
Well, we want to thank you. There are some few more questions, but I know we had run out of time. We want to thank you for you to being here today. And we'll do our effort to continue answering some of these questions online for the people who had have typed some of those questions. And kind of your contact, the contact for Dr. Ball is on the screen right now. And I'm kind of pass for the next presentation. Thank you, Dr. Walt. Thank you today for being here with us today.
Thank you. Thank you, Claudia, so much for facilitating. Thank you, Dr. Ball. We are so fortunate to have a Latina pediatrician that really understands the opiate and fentanyl. So you're probably going to get bombarded with a lot of calls, but we need your help, and we definitely want to be at the table, LCA, and of course, UCMAR, to continue this conversation. So thank you so much for joining us.
Thank you so much for giving me the opportunity.
You bet. Our last presentation may go a few minutes late, but we're doing well, is Dr. Luis Zayas. There you are. Dr. Zayas is a professor and Sutherland Chair in Mental Health and Social Policy at Steve Hicks School of Social Work. He is a professor of psychiatry and behavioral services at Dell Medical School at the University of Texas. The University of Texas. So he will talk today about migration, detention, separation, traumas of Central American children and families seeking asylum. I want to thank you so much, Dr. Zayas, for joining us. I've been looking forward to this presentation and having you. And I would like to say before that he has released a book. He did write a book. It should be published soon. So we will share the link to your book so that so people could order the book online.
Okay, first of all, I wanted to unmute myself and make sure I unmuted, and pardon the darkness. This is not my office. I'm coming to you from Brownsville, Texas, where I'm here at the University of Texas, Rio Grande Valley. So at the opposite end of where you are. And now I will try to share the screen that I have to tell you something about my work. Okay, so here it goes. And this is always an issue trying to put this in observation mode. Okay.
Let's see.
Dr. Zayas, yep, there you go.
There it is.
Perfect.
Thank you. I just learned something new. Appreciate it. Okay. Well, anyways, I'm Luis Zayas. Very happy to be here, and thankful to Nina Martinez for reaching out to invite me to be with you today and to tell you something about my work. But more importantly, not just my work, but the situation that's facing Central American children and families who come to the United States seeking asylum and ultimately will arrive and appear in your communities, excuse me, your communities and your agencies and your service agencies in time. Let me just say that the work that I'm about to talk to you about has been supported by National Institute of Health grants. I have no other disclosures with respect to financial support. I do want to make sure that you all know that I'll be presenting some pretty graphic photos and videos to get across the point about what it is to be an immigrant and to be detained as a child and even separated. So some of this might be disturbing. So I just fair warning that it is included here. So what I want to talk about, is there any ways I'm getting some, let's see, okay, stuff is blocking my screen from whatever the PowerPoint here. Let's see. Okay, so I want to talk about asylum-seeking families and children from Central and South America who are entering the United States, and talk about the stages of migration that are important to know, because at each of those levels, there are experiences that children and families have that are important for us as providers of clinical services, whether we're talking about medical services or mental health, behavioral health services, or educational service, or any other service about what happens to families and how they get here. Talk a little bit about it, immigration enforcement, what happens with detention, deportation, separation when that occurs. It occurred more in 2018, and then what happens with release and the development, and look at the developmental and mental health aspects, impact on kids. And this is the book that was just mentioned. Actually, just as a footnote, today is the release date, February 21st. So I guess the timing was right for me to do this and to tell you about that the book is finally out as of today. I'll talk about human migration, human development, the neurobiology of stress and trauma very briefly, but mostly focus on how detention and separation impacts children's attachment and mental health. After many years of meeting with families, many years since 2014, when families were first put into detention from Central America, I began to discern that this is what, pretty much the trajectory of families. They're in the pre-migration period, they are of course in their homelands with their families, and increasingly there's distress that causes them ultimately to decide to leave. But that stress comes from issues of police ineffectiveness, government instability, violence, gang violence and extortion and kidnapping and ransoms and things like that, as well as interpersonal domestic violence, interpersonal violence that drive people to leave. One of the more recent conditions that's appearing increasingly so is the impact of climate change on their livelihoods, causing already fairly impoverished people to become even more impoverished. And that's at that point in the model here, you see on pre-migration, there's this breach between between that and the mid-migration, which is at the point that a family decides to leave. And you see the little trigger event explosion there. That's intended to show that something has happened in the family's life. It could be any number of things, including the attempted recruitment of a child, of a son, typically, to the gangs, and a family decides it's time to leave. And they make that decision. It could take several months, several days, sometimes several hours to say, let's get out of here. And over the course of meeting hundreds of such families, any of these scenarios is possible. When they make that decision, they begin their migration. And that's the section here, the middle section called the mid-migration period, which is in the model just a piece, but it could range from weeks to months of traveling. In some cases now we're talking about perhaps a year or more, where they travel from Honduras and El Salvador through Guatemala and into Mexico and traverse their way all the way through Mexico, having, in the case of others, to travel. We're talking about Salvadoran families, Hondurans and Guatemalan families, and so they will make that. And so that mid-migration journey, a lot of things happen during that time. They reach the border, and that's the point where they do the crossing. It could be any number of crossing. It could be a simple pedestrian bridge that gets them to the Immigration and Customs Enforcement, or it could be in between where they're then caught by the Customs and Border Protection. I am literally sitting less than 150 yards from the border as we speak, and the river is right there. And I'm told by the folks here in Brownsville how often they come across and even enter onto the campus, because the campus backs up into the international border. Upon being detained, they're put into detention. I'll talk more about all of that. And a lot of things could happen, critical incidents like in 2018, the separation of children, situations like others where I've had one father who suicided in a cell while his 4-year-old son was in there with him. And so those are some of the things that happened. Ultimately, there comes the release, and now with the surge and the overwhelmed immigration courts and asylum officers, there's a long time before they get a court hearing, which is way there at the far right of the little courthouse. So that court hearing could take for a long time. That's the post-detention period, which involves settling into American life and adjusting to life in a new country, even if it is somewhat suspended because they don't know how long they'll be able to stay. Again, pre-migration conditions and the decision to leave. Again, here are those powerful images that I've been told you about before, where this is daily occurrence. These are pictures that appear in the press, but it's something that may appear in press for us, but is very prevalent in the lives of many of the Central Americans, those from the Northern Triangle countries who come to the United States, who will risk life and limb, their children's lives, their own lives, for safety and security. And because of that violence, families simply can't stick around. That's part of what they start with. Here's the case of what was happening in Venezuela more recently, where you could see, while it wasn't the same sort of violence that we see in Central America from Venezuela, you know, poverty and food scarcity are just awful. And that's a picture of a supermarket that was just simply depleted of all its merchandise. And on the right is a feeding center for those who just simply are too hungry. And this is a picture provided to me by a child to give you a sense of the impact on the children of this pre-migration violence. So a little boy named Danny, who was 7 years old at the time that I interviewed him, did a psychological assessment of him in Karnes Detention Center, which is in Karnes County, Texas. And it fares pretty heavily in the first chapter of the book that we just talked about, where I talk about my first visits to Karnes, where I met kids like Danny. Also, this is detailed in a TED Talk that I did in 2019. Danny lived in Honduras in a small town with his, outside of the town on a farm, with his mother and father and older brother. His uncle and his aunt lived nearby, and his grandparents lived nearby. And I asked him to tell me about what it was like, you know, to draw me a picture of his town. And this is what he drew. And he called the gang members. This is a local name. I don't know, you know, how accurate it is. You're hearing from a then 6-year-old, now telling the story as a 7-year-old, that the Rebos Locos were the gang that marauded their neighborhood. And I asked Danny what made them, you know, bad guys. Oh, because they smoked cigarettes and they carried guns. And you see in the picture there, they're smoking cigarettes, and they've got guns, and they're terrorizing people. Notice at the bottom right, the characters, the figure drawings that he's making. He made causing the death of someone who's in a box there, and just harming families. And like any child who draws a picture like this, he includes the son. And if nothing else, the son tells you that the emotional terror that he felt as a 6-year-old. Now he was, again, I want to restate that he's 7 years old at the time that I interviewed him, but it had been when he was 6 that this was happening. The trigger, remember when I talked to you about the ultimate trigger for families to leave occurs. And in Danny's case, it was the following. He was, this is up at the top are his abuelos, grandmother, grandfather. Over to the far left is his aunt and uncle's home, and to the bottom right is his family. And the Rebos Locos are around town. And he tells me that one day he heard gunshots in his uncle's house. So he ran over there and found his uncle dead. Some man had broken into the house and had shot him. And Danny actually saw his uncle dead, bloody, his disfigured face, disfigured by the bullets, and on the ground. I mean, he puts him outside, but actually he was in the kitchen at the time of the killing. And he tells me how he remembered the one thing he stuck out for him was that he saw his uncle's teeth protruding from the back of his head. So that's not something that a 6-year-old makes up, right? It's something that they would have to have experienced. So he's drawing this day where his grandparents at the top, as you see, are horrified and weeping. His mom is just devastated. She's on the floor, on the ground, thrashing, and his father's there standing by. It is a maternal uncle that was killed. That was the trigger for this family to leave. And they could no longer stand it, because sooner or later they would come after the rest of the family, the Rebos Locos would. And so the family set out one day shortly after this. And by the way, the Rebos Locos at one point, these are teenage boys, had beaten Danny severely. It was 6.5-year-old boy, which is, just impossibly kind of cruel, right? And so they decided to leave. They tried once, but they couldn't get very far, because if you look carefully at the drawing down here at the bottom right, his father is a single leg amputee with crutches. And so they set out, but his father could not manage the journey. They came back, they spent a couple of days at home trying to fashion a new set of crutches and things. And they tried again, but he couldn't make it. But his father said to his wife, take the boys, save them, I'll stay back. At the point that I met Danny, and this was 2015 or so, he had not heard about his father. He didn't know if his father was dead or alive. And so I lost touch with him once we were able to get him and his mother and his brother out of detention and working with attorneys. But these two drawings are the childlike, or a child's depiction of what it's like. And it, a picture tells 1,000 words. And in children, we get what the interior emotional life is through their drawings. Once more, that sun, look at the sun, it's just terribly distressed at what's happened. And what we know is that when we witness the death of someone, when we see a dead body, not a body in a casket who's been taken care of by the mortician or the embalmer, whatever their term is, but when we see someone being killed or a dead body still mangled, perhaps from an accident or whatever, or even watching as it happens, a serious injury that might not lead to death, it is very stressful and even traumatic. And we do know from the research done at Wally and others, and Ferry and others, and Hackett and others, that this event of seeing someone die and seeing a dead body that's really destroyed adds one of the largest parts, if you will, to PTSD. It's the one that's most impressioning, and long-standing. So it creates longer symptom duration than might be the case if they had not seen the death of the body and so on. It affects memory and helplessness, and the memories begin to form that become intrusive and often vivid recall. We know from that PTSD, the whole flashback, the fugue states of dissociation and things like that. And of course, the more trauma you see, the more distressing, the greater the level of impact it has on the formation and the duration of PTSD. Now they've left their country and they're now cutting across Guatemala in the case of others, and into Mexico. And the voyage, the journey is fraught with questions about who do we trust, where is the danger, and what's going to happen. And they will see danger, depravity. They have to either hire coyotes to help them. They have to face criminals and organized gangs along the way. Back to this issue of trust. I heard from families, they didn't know who to trust on their way up. Who was in cahoots with the police or with the gangs? Was that old lady sitting on the church steps, was she trustworthy or not? I mean, you cannot trust anyone. And so that adds to the stress. again, they're witnessing violence and death along the way, and they become victims. They're in prison sometimes by local gangs who want them to call back home and get more money for ransoming so that they can continue on their travel north. The deprivation, the intimidation, the physical abuse, the sexual assaults. I mean, it's quite something. I detail this in the book, so if you want to know more about it, I think it's important to see that how families, women in particular, and girls have to deal with the awful circumstances of the mid-migration journey. Again, the mid-migration, the risks and the challenges of hunger, animals, criminals, and so on. And the time frame for this mid-migration, as I mentioned earlier, is different for different families. Some people made it pretty quickly. Some took months to pull together money. They were stopped by La Migra, who took their money, and so they had to now earn more money to pay their coyote to keep on moving. So it really is not an easy process. Excuse me, that's the mid-migration journey. When they arrive at the border and they cross over, however they cross, they're apprehended, of course. And of course, they seek apprehension because they want to request asylum. And the Customs and Border Patrol, any law enforcement that finds them, the Immigration and Customs Enforcement, ICE, must honor their request. And from there, they go to what are called hieleras and perreras, which informs the title of the book through ice boxes and kennels, which is, of course, a translation of hieleras and perreras. It is the first introduction to the American immigration enforcement system. And they're called family residential centers, but you and I know they're prison cells. Families are kept together. But let me just go back a moment. The hieleras are these cold rooms, and let me see, here's a picture of a hielera, or several pictures. And if you notice, this is what happens. They just arrived on the border. They're tired, they're hungry, they haven't bathed in days. They might be wet from crossing the river, the Rio Grande. And this is the first stop that they're placed in. These are hieleras, which look like, kind of a gym locker rooms where everything is tile and cold. And it's intentionally kept cold. The lights are on all night. It's part of the immigration system's attempt to break them down and deter others from coming. The lights are on all night, all day and night. It's cold in the 60 degree, sometimes colder. They're given these Kevlar, I think, whatever these are, blankets that we see more at the end of cold marathons in cold weather. But here they are kept in here for anywhere from 24 to 48 hours. I'm sorry, to 72 hours. So it's difficult, but look at also the indignity that our system imposes on them. At the back of each of these, you see in these two yellow water coolers, and one in the top, it's orange. On the other side of that wall is one toilet. And all 30 or so people who are in there must use that toilet. And that means you're going about your business, we would say, exposed to others. People are watching and seeing. And that adds also further indignity and harm to the families and the kids. At one meeting, I met with colleagues who had been talking to some of the kids at these detention centers in these hieleras, and a group of girls were saying how they slept around the toilet because somehow the water warmed up the tiles there. So it gives you a sense of what desperation is, and people doing things that perhaps most of us wouldn't consider doing in a public bathroom. We know that when you hold people, children in detention, you're creating a level of trauma, and there are two elements to that trauma. And one of them is the deprivation that happens in detention. Children and their parents are deprived, let's focus on children. The children are deprived of their typical developmentally expected routines, right? When they're in a detention center, after they've left the hielera and now they're in a prison cell as a family, the parents no longer have any authority over their children. They don't cook for them, they cannot cook for them. Everything is governed by the private prison company that runs the institution. And so children can't ride bikes. They don't go to, to the candy store in the neighborhood, all the things that we expect our children to be able to do, interact with teachers and, merchants and, go to church on Sundays and attend Sunday school with you or whatever the case might be. All of that is lost. So children who spend time in detention have that part of their developmental experience is simply deprived and truncated and has devastating effects. The other trauma is the threat. The constant threat when you're in detention that you may be physically menaced by staff. They don't typically, they're not necessarily physically abusive, but there's that threat of abuse, of physical violence, and psychological violence is common. Guards saying, oh, you're never going to get out of here. Oh, as soon as we can, we're going to separate you from your mom. Whatever the case may be. Oh, we're waiting till you turn 18 because then you go into adult immigration and that's another story. So these things add to what the stress and the trauma that of being in detention. And so what are the results of that? We've seen sudden upsetting memories. Kids have nightmares, reminders and threats, night terrors, sense of humiliation. Children report numbness and dissociative episodes. Not only do they describe, but their parents describe to us, both in detention and after. They never get a sense of safety. They're not going to, well, not never, but without intervention, but they don't have a sense of safety even once they're in the prison, because you don't know what's going to happen. I call them prisons. They are called detention centers, but typically they're converted prisons. The parents' mental health, of course, is affected, and their functioning is diminished, and consequently, a child has to deal with that, kind of, with what's happening to mommy or daddy, and so on. And the parents' mental health is affected. The traumatic separation happened in 2018 during the family separation policy, and we saw all sorts of terrible effects on children. And I'm going to show you in a couple of minutes how that affected children, in particular, the distress and anxiety, again, what happened when children were separated for months. And then once reunited, we could see reactive attachment disorders, which is DSM, disorder, classified disorder, where kids have trouble reattaching to their primary caregiver. I'm sorry, let me just go back a second. So not all children who spend time in detention are separated, but beyond being traumatized by detention, they were traumatized by the separation. And we know that human attachment is critical for growth and development, right? It is attachment between the primary caregiver, most often mom or a maternal surrogate, is the fundamental human bond, child and parent, right? That's universal and from the beginning of time. And we do know that a secure attachment between a parent and a child has lifelong implications for the child's mental health, their interpersonal relationships, their development. A securely attached child is confident, has positive interactions with parents and others after a separation. And that security has positive outcomes, their emotional development, behavioral, cognitive, social. And across cultures, the securely attached child is the modal child, the average child, normal kid, kind of in a normal distribution, the bell curve, that most kids in cultures are securely attached, despite the fact that parenting styles may differ by cultures, but still, regardless of the culture, the child who is secure is the most often seen in cultures. So here's this goes back to the work of John Bowlby on separation, attachment, human attachment, imprinting, and so on, and it introduced the importance of that, and Mary Ainsworth and others advanced the field to understand what attachment is, when you have secure attachment, and the types of insecure attachments that happen when a child is suddenly separated from their parent, and then are reunited. She had this research in which there was episodes of being together and being separated and reunited, and the presence of a stranger and so on. One of the insecure attachment styles that she and others have substantiated through the research is what's called insecure avoidant attachment. So that when a child is separated for some period of time and then comes back to their parents, the child responds with an expectation that they're going to be rejected yet again by their parents. If that's, that may be some of the fear when they reunite. So the child avoids the parent and may kind of, stay away from them, or if held, might really pull away from the parent, rather than seeking proximity, which is most of you, or many of you, all of you know what children do when mom and dad get home from grocery shopping and grandma's been taking care of the kids, or they've had a babysitter. They run into their, oh, I'm so happy to see you. What do you got in the bags? And what did you bring me, cookies or whatever? That's, a securely attached child at the separation. But when we had in 2018, the family separation policy, which ripped children literally out of parents' arms, we were doing untold harm. And so later, when these kids were reunited, reunified with their parents, we had these indication of the different insecurely attached children. And so one of them, as I say, is insecure attachment, to display avoidant behavior, and they don't get close to their parents because they anticipate conflict or rejection. And so this here is a case of a little boy. This is on the internet. You can find it easily. I'm giving you just a clip of it, of a boy in 2018 who was reunited with his mother after being separated for 3 months by the Trump administration. And in this case, the father and the mother, I believe they were Honduran, father and the mother, this little boy and his baby sister all came to the border together. At that point, they were separated. They were taken into custody and separated. The mother and the baby girl were placed in, were taken somewhere else. Then the father and the son were taken this occurred in Texas. I think the mom remained someplace in Texas. The father was moved to Arizona. And from there, his son was separated from him and moved to someplace, I don't know, Michigan or far, far away for 3 months. So this boy lost his mom traumatically, then his father and his sibling, his little baby sister, of course, and separated for 3 months. He was held in foster care. Finally, they were reunited this day in July of 2018. As you'll see, this boy, he's about 3 years old or so, and he demonstrates the insecure avoidant attachment after this lengthy separation, where he didn't know where his mommy was, he didn't know where his daddy was. So to get to this point in this reunification, the boy was brought to his father in Arizona from wherever the boy was, reunited there. We don't have video evidence of what happened there, so we will have to guess that it was not pleasant for the boy. And then they're flown to Bush International in Houston, where the mom and the daughter were brought. So this is the first time that this little boy sees his mom. I'm going to play the video for you so you can see both his mom's pleas and his behavior. And I hope that the sound will carry to all of you. Let me know immediately and I can replay it. So, notice she's crying out, I'm your mom. We've been separated. I'm your mother. And you see how he's pulling away. He is avoiding her like the Dickens, and it continues. He pulls away. She's asking her husband what happened. He's holding on to the baby, that he hasn't seen in 3 months. The boy crawls over. When I first saw this, I thought, well, maybe he's going to go to his dad, but no, he goes right between his father's legs and continues on, sits behind. His mother pursues him. So you see in this video, and I again, this is one of those moments, it's hard to watch, and for those of you who are seeing it for the first time, it really is very difficult to watch. But you see that a rupture in the attachment, the way it was handled during the family separation policy, what the tragic results could be. This boy his family were featured about 6 months after this on 60 Minutes or one of those shows. I think it was 60 Minutes. And they were interviewed. And the mother was saying that, you know, he's still not the same boy. He's starting to come around, but he's not the same boy that we knew. While they videotaped him, he was more engaged, but still you could sense that there was a distance, this boy, between him and his mother and his father, that he just, even 6 months later, we don't know also if there was any intervention that had occurred between the time of the tape you just watched and the video that was shown in 60 Minutes. 60 Minutes. But I think we have to think about what are the interventions. We'll come back to that in a minute, because as providers and community leaders, you've got to think about this. So, that's one outcome of a child who presented that way, who's been separated. In the second video, I'm showing you a child who was also separated, except he had a different insecure attachment. His was called insecure ambivalent. And in that case, the child is not really sure that he can trust his parents. So he might come closer to them, but he's not really sure. Can I trust you? The child is uncertain if the parents' response, what this parent's response will be when they reunite after this separation. And they can display passive or angry, resistant behavior that really determines how close I'm going to get to you or not. And then when the parents responds, trying to get their child closer, the child may be ambivalent. And all it takes is the mom or the dad or that attachment figure to say, I got to put you down because I got to get the clothes out of the laundry or something, out of the dryer. They may see that as abandonment again. And so they're ambivalent. And so it may cause the appearance of the distress. So again, this is another approach. In this video, this is a boy and his mom in a shelter. They had been in detention, separated, brought together again, held in detention. I don't know how long apart they were. That was not in the data I have. But this is a boy who's about to go to bed, and he demonstrates this insecure ambivalent. Again, he's in a shelter with his mom. You see that he's uncertain of his mom's affection, and he becomes angry and resistant. One other point. Earlier in the video, he's seen interacting with his mother the way most kids would, laughing, hugging and doing. But something happens as nightfall comes. And we have to ask ourselves, so what happened to this child that bedtime is fraught with anxiety and where all of this insecurity begins to reemerge? What, we don't know. What did the mother do? Not that she intentionally did it, but that the child perceived a rejection or an abandonment just prior to this. But here is the boy and his mom at night. And this is where we begin to see the insecurity and the ambivalence. Here we go.
toda esta separación fue muy larga. Mi hija ya ha cambiado mucho. Con tanto trauma. Ya no quiero ser tu hijo, ya no soy tu hijo.
So you see yet another result. These are 2 of the thousands of children that have been separated at the border. And while there was an uproar, as you recall, in 2018, and the family separation policy was rescinded, it continued on for much longer than that into 2019. And even today, there are children who have still not been reunited with their families. Over 500 kids still have not been reunited, whether in the US or back in their homeland. So this is just one example or 2 examples of the kinds of kids and the experiences that will be appearing in your communities. So as providers, we need to say, how do we intervene with these children? This is just 2 cases, but kids like them, different age group. How do we, what parenting work do we need to do with the mom in both of these cases? Wonderfully, though, is that both of these moms are very sensitive to their child. So it makes your work as providers much easier, because you saw that last mother who was really kind and gentle. Who told you that? And she doesn't get upset. She doesn't yell at him and say, how could you say that? I'm your mom. Then she really handles it well. So it really bodes well for intervention. Same thing with the first mom. I mean, she was just distraught that her son would not. What are the mental health services that the parents are going to need? The father in the first video, we don't know what's happening with him. He had suffered a gunshot wound. That's one of the reasons they had fled. And so that was part of the trauma. But, separation from his wife, from his daughter, what that has meant to him. What services would you identify for these families in your community? And how should your community organizations respond? How should your churches reach out to them to engage them, in places of safety and worship, where they can create community, where, a lot of commerce happens, where, where's the best place to buy this, or what schools are best to enroll my children? All of that happens in communities, places like churches. So how do we, as social service providers, help families prepare for this? So even today, we have detention. The folks are being kept in hieleras and perreras, there are very good people working in ICE and CBP who care deeply about the people who are crossing the border and understand the dangers that they have faced and the traumas, and they're kind. Not everyone is the same. One of the difficulties of having a detention center system that's operated by private prisons is that they come at it as prisoners. Imprisoners. That is, from a penal mentality of these are not families, these are prisoners. These are, these are not immigrants, these are criminals. So they have this mentality of a punitive guard mentality, rather than doing what we should be, which is serving as guardians of these families. So we do have that struggle, and I think it's important to know that this is what the kids have gone through, but also what we can do to serve them once they're in. The post-detention and beyond is something, like I said, where we're going to have to face these families. They are released into our communities. And there are 2 processes that happen. One is the kind of the assimilation part, which is settlement, getting housing, employment, getting the kids enrolled in school, good pediatricians, churches, and so on, as I mentioned. But then there's the psychological adjustment, which is far harder for many of the families. How do we help maintain their psychological well-being after these piling on of traumas and stresses and hardships and physical, deprivations that they have suffered, and the disruption in family rituals and family functions and parents' mental health? That's what we're going to be facing with many of these families, and we need to be there to provide them help. Another group of kids, and this will, I'm coming to the end and open it up for questions, are the unaccompanied children who enter the United States. And it's a new area for me. I'm less familiar with it. I have not worked as much, but I have engaged in trying to understand what their needs are. If you recall, we don't really know what happened to that little boy in the first video during the time that he was separated from his parents. But we do know, and as providers, we could get the parents to tell us what it was like, why they left Honduras, what it was like during the mid-migration process, what it was like in detention, and then the reunification. And so we have at least adult informants in both of those cases, the first two. But when it comes to unaccompanied minors, we don't have that. They're coming, especially young ones, they're coming these long stretches, but we don't have the adult information. And children, as we all know, that may not share with us what their experiences were, and they do it by drawing and by play and by the sorts of experiences they had. So in this video here, I want to show you what happens to two little Ecuadorian sisters, ages 3 and 5, who were dropped about a year and a half ago, 2 years actually, going on 2 years, dropped near Santa Teresa, New Mexico, west of El Paso. And this is in the middle of the night. The story, once it broke, was that these girls had been left with their grandparents in some mountainous regions of Ecuador, not Honduras or Guatemala or Mexico. So they had to traverse, the coyotes that were hired by the parents brought them from Ecuador. I'm trying to think of my geography, but that would have meant, Ecuador, I guess Colombia, Panama, and perhaps depending on the route, Costa Rica, and then the other, all the way to the United States. Far, it's kind of more like several thousand miles rather than the 1,800 or so miles from the Chiapas, say, to the United States. And so these girls were brought by a coyote, and here's what it looked like the night that CBP caught them with night cameras being dropped. As you see here, the coyote is on the wall. He stretches down just to try to break a little girl's fall. That is the 3-year-old girl who was brought, and he's dropped. The height of this is about 14 feet, as I understand from reading. And now he brings over another child, a sister. Meanwhile, the little girl who has fallen is just staggering, getting up. The second child is dropped, and a package. The coyote drops the children and runs off. Let me stop there. I have 2 granddaughters, literally this way. Well, one is 3, one is 6. I cannot imagine, and I'm sure you can't either, what it must be like for your children to be in the hands of coyotes covering maybe 3,000 miles. You don't know, you've paid and you're hoping and you're trusting that they will actually bring your children to safety, take care of your children. So when I look at these 2 little girls, I think of my granddaughters and how emotionally pained I would be. I don't know that I could live. But as I play this tape here, you'll see the 2 little girls interacting, and the camera watches the 2 coyotes running off still. But when it comes back, it doesn't show it. But the video continues, and the 2 little girls are talking. I can only imagine what they're saying, because it seems like the little one, the first one that was dropped, who gets up and staggers, is going to the older one and saying, I don't know what she's saying, but you okay? Where are we, or something. Just imagine what it's like. That little bag that was tossed afterward, in there, there were the documents, the girls' documents, birth certificates, and a cell phone with only one number in it, their number to their parents in the United States. And so these coyotes did their job, and these children, as it turned out, were picked up. They were picked up by Customs and Border Protection, and these are literally the pictures of the girls, of course, you know, their face is not shown, and the female CBP officer who was there first with them. Excuse me. As clinicians, as providers, we have to ask, how do we assess these girls? We don't have a history of what happened to them during the migration. You know, they were found to be healthy, nothing had happened, there was no sexual abuse, but we still don't know what, you know, hunger or deprivation they experienced along the way. So we don't know about their experiences. As clinicians, what do we then tell parents to watch for? Because, by the way, they were reunited with their parents here in the United States, and the government backed off, did not pursue any charges against the parents because it was more important to maintain the health of these two girls. But what do we tell the parents to watch out for in their behavior, this attachment issue, other issues of trauma? These children were not ripped from their parents' arm. The parents had come to the United States to try to, you know, get a foothold, an economic foothold, and bring them their children. You know, what services would we provide for this family in your community? And what does your organization have to adapt to respond to families like this one and others? You know, I don't have the answers. None of us do, but it's what we're going to face and what we're already facing in the United States with children who have come and sought asylum. We do know that there's a number of things that we need to be prepared for, the child-parent psychotherapy, you know, really work with them, parent-child interaction therapy. How do we help build the bonds again between a parent and a child, help parents understand why their children are behaving the way they are? And of course, we have to think about the parents' own mental health, right? Their own mental health therapy for them, as well as psychoeducation, so that they can understand the child's development, the self-awareness of what they can do to try to minimize the impact of all of these traumas on their children. Family therapy to build communication, cohesion, and the flexibility that families need. And of course, you know, any psychological adjustment requires that settlement period too. How do we engage them in recreation, schools, youth groups, family groups, churches? Again, I come back to that as a means to help families reintegrate and assume normal lifestyles. Those are the topics and the questions I've had, and I'm ending here.
Dr. Zayas, respect your time. I just want to tell you how profoundly grateful that I am that you took my call when I made that call, and that you volunteered your time to join us for this important presentation. We have a lot of questions that I'll be following up with you on, but you know, this is definitely heartbreaking, but I appreciate your work, and I appreciate you bringing this to our awareness, and we'll continue this conversation. So I want to thank you so much for joining us, Dr. Zayas.
Thank you very much for the invitation, and to your audience. You know, I know this is not easy for a Tuesday afternoon, but I think it's important that we see it and understand it more deeply than just what we read in the papers or the biased reports we get in the news. So thank you very much.
Thank you, Dr. Zayas, again. Thank you so much.
Thank you.
And now I want to introduce Jimmy Mata. Actually, he's a council member of Burien, but also Latino Civic Alliance board member and vice chair, and he will close today. I just want to say that I admire Jimmy Mata, Councilman Mata, because he's done some incredible work in Burien. So I'm grateful that he's on my team. Jimmy?
Muchas gracias, Nina and Doctor. Thank you very much for the information. You know, it's a story that, you know, I share as coming from immigrant parents from Guatemala. So muchas gracias. But today I have the pleasure of reading a couple of words for closing remarks. Thank you very much, Nina, for giving me the opportunity. But I'll go right in it because everybody knows me, and if I don't stay something written, I can go off for a while. So honorable elected officials, respected appointed officials, and esteemed guests, today we have marked yet another historical year of empowerment for Latino and Latina community members. Today we have highlighted the injustice and inequitable treatment ranging from public and private procurement opportunities and the economic hardships left over by the COVID pandemic and immigration. These past 3 years haven't been easy. The ongoing economic hardship with raising interest rates and a slowing economy continue to target the political and social inequities of our communities and what they face every day. the need for social emotional learning programs, relief for families in our state battling high rent costs, the need for more business opportunities and training programs is extremely important. We will need to work together as we begin to mend the ongoing disparities in the current economic state of our country that have been unveiled and will continue to make worse if we do not engage with the decision makers and vote for elected officials who get it. To every presenter, speaker, politician, guest here today, I thank you from the bottom of my heart. I urge you to harness everything you have learned today to continue making meaningful changes in our community. As leaders, we can and must, as the leaders, we can and must do much more to provide the information and resources our diverse community needs and for which they are crying out for themselves, their neighbors, and their family members. Our community deserves more than we are receiving. Performance, not promises, is what we need today. And I want to thank everybody as we continue to flourish in Washington State. It's just great to be around great leaders. And Nina, I appreciate your leadership, not only here in Western Washington, Eastern Washington, across the state, and making sure that you're holding all of us accountable, not only the leaders, but the elected officials. Muchas gracias. Buenas tardes.
All right, everyone. Well, this ends our Latino Legislative Day. Thank you, and visit our website, www.latinocivicalliance.org.